Welcome to this online consultation on enablers for improving access to social protection, jointly organized by YUVA and UNICEF. I think it's a very, very important, timely consultation. I am very happy and thankful that you're giving your time and investment today to discuss this important topic. I think post-pandemic social protection का जो पूरा social policy का जो पूरा space है, it became very, very critical. Particularly for the most marginalized urban and rural poor, the migrants. And in that context, बहुत सारा काम हो रहा था जिसको और भी strengthen किया गया. And I think ये पूरा जो space है, both at civil society and governments, there was a lot of importance given to this space. इसके लिए, as you know, बहुत सारे आत्मनिर्भर हो या महाराष्ट्र state ने भी जो अपना डिटेल प्लान ऑफ एक्शन बनाया, स्कीम्स लॉन्च किए. सो आई थिंक ओवरऑल द पैंडेमिक का कॉन्टेक्स्ट ने सोशल प्रोटेक्शन को बहुत ही एक इम्पोर्टेंट स्तर दिया है. एंड इन दिस कॉन्टेक्स्ट फरवरी में युवा एंड यूनिसेफ हैड ऑर्गेनाइज अ कंसल्टेशन की ये स्कीम्स एंड सोशल प्रोटेक्शन का जो पूरा स्पेस है उसके लिए कन्वर्जेंस की क्या जरूरत है. सो दैट वाज अ इम्पोर्टेंट कॉन्वर्सेशन व्हिच वी हैड इन फरवरी एंड पोस्ट दैट अ सोशल प्रोटेक्शन कंसोर्शियम का जो एक सीडिंग हुआ. And that consortium is beginning to build and start working on issues at the state level. वो अभी भी initial stages में है. And today's consultation is to take forward that conversation. And as we know कि schemes का होना, policies का होना is one matter, but उसका actually ground पे implementation में बहुत gaps होते हैं. उस space में NGOs बहुत एक critical role play करते हैं. So I think आज के consultation really is moving with those main, two objectives के really trying to understand what are the various approaches to facilitate the last mile access to social protection and अलग-अलग stakeholders का क्या role इसमें होता है. And ये जो पूरे प्रक्रिया है उसको कैसे streamline किया जा सकता है, not only in urban areas but rural and tribal areas में भी. And finally, hopefully एक conversation हो सकता है कि इसको institutionalize कैसे करें, इसको systematically embed कैसे किया जाए ये पूरे facilitation का जो प्रक्रिया है within the larger systems space. So that is the context of today's conversation. We have very briefly, we are sharing the agenda. We will start with an introduction by Rajeshwari, who is the CFO of UNICEF, followed by 6 different models of social protection facilitation, जो लोग उसके बारे में अलग-अलग संस्थाओं से campaign से आके उसके बारे में बात करेंगे. Then we will have a larger conversation on how models can be institutionalized. And then finally, an open discussion on how to take this forward. So that is the flow of today. And I want to introduce Rajeshwari to open today's session. She is the Chief of Field Office, UNICEF Maharashtra from 2013. And we all know Rajeshwari. I think she's a very, very iconic player in the social policy landscape particularly. And during the pandemic, I think UNICEF has played a hugely important role. So we're very happy that she is here with us today to really set the stage, a context set करने के लिए moving forward. So welcome Rajeshwari, and just 2 technical points before we start. हम थोड़ा हिंदी and English mix करने की कोशिश करेंगे. And if there are any technical issues, please do message either me or anybody else from YUVA. Satej is there, the technical support. आपके लिए कुछ technical issues है. And without any further ado, over to Rajeshwari.
Thank you, Roshni from YUVA. Good morning to all the members of the core group of this social protection consortium. Dr. Abhay Pete, Mrs. Ashwini Kulkarni, Mr. Amit Narkar, the experts in the field, as also academia who's here, and Roshni, the YUVA team, my own UNICEF colleagues. जैसे रोशनी ने बताया, ये शायद second consultative meeting है to look at what could be the enabling environment for social protection in India and specifically for this state. And जैसे हम सब लोग समझते हैं, जानते हैं और experience भी कर चुके हैं, social protection is looking at a whole range of policies and programs जो कि poverty or exclusion को address करता है. And this, by that we mean that social protection schemes will help connect families जिनको बहुत ज़रूरत है to healthcare or to nutritious food or to quality education, such that उनके बच्चे एक minimum quality of life जी सके. No matter कहाँ पर उन्होंने जन्म लिया, no matter किसको जन्म लिया, but it is important that हर बच्चा को एक fair chance in life मिले. And therefore, अगर ये हम ensure कर सकते हैं, then to a large extent हम SDG के goals को भी meet कर सकते हैं. But when we talk of population in general, हम शायद specifically कई लोगों को जरूर mention करना जरूरी है, क्योंकि these are the people for whom social protection is an absolute must. हम जेनेरिक पॉपुलेशन को जरूर पहुंचा सकते हैं, बट अगर हमने ऐसे जरूरतमंदों को फोकस किया, जैसे those who live in hard to reach places like let's say the tribal habitations, या जो कॉन्फ्लिक्ट या वायलेंस के विक्टिम्स होंगे, या जिन्होंने कोस्ट लाइन में रह के नेचुरल डिजास्टर्स के विक्टिम्स हैं, उनको घर हमेशा in one flood devastate होकर वो दूसरी जगह चले जाते हैं, और the migrants who because of seasonal employment एक जगह से दूसरे जगह जाते हैं, और finally you look at the urban poor जो slums में रहते हैं, जिनका ना आता है ना पता है, and they don't, many times they don't have an identity, a proof of residence. मुझे लगता है कि ऐसे populations को, और इन populations के बीच में लड़के और लड़कियां जिनमें disabilities हो, then it is double whammy. Not only they are in tribal areas, not only they are poor, but they also come with some physical or mental disability. इनको शायद social protection का बहुत खास focus रहना जरूरी है. Now, जैसे रोशनी ने बताया था, COVID को चलते हुए there has been a lot of concern regarding social protection, जहां पर बहुत तरह के लोग, और जिस categories का मैंने जिक्र किया था, like migrants, poor, urban poor, people with special needs, इनको impact कुछ ज्यादा ही हुआ है because of lack of proof of identity, proof of name. बहुत सारी schemes जरूर शुरू हुए थे during the COVID, but because these people don't have a name and a residence and a proof of identity, उनको वो benefits नहीं मिल पाया. And इसी के दौरान lot of studies have been done at different stages by different agencies, जिसमें they had looked at targeting, they had looked at enrollment, they had looked at how is money disbursed, what is the back-end processing of benefits, and काफी सारे challenges निकल कर आए. For example, there was no information flow, so जिनको मिलना था उनको ये नहीं पता था that they are entitled for such a scheme, और जिसको नहीं चाहिए था उसको मिला, और unavailability of required documentation, or the design itself of the scheme में कुछ खामियां थी, budget was not enough there, and most importantly coordination, जिसका भी जिक्र रोशनी ने किया था. If you have to institutionalize social protection, you need coordination and convergence among departments, ताकि हर एक का अपना accountability बहुत clear होकर है. And without a strong monitoring and evaluation system, you will never address. So I think an integrated social protection mechanism must look at must address all of these issues. और ये जो studies ने ये challenges निकाल कर लाए हैं, they have also looked at specific schemes as also the broader recommendations related to social policy. But all of these recommendations cannot work in a vacuum. They will only work under one or two conditions, which is कि हम civil society organizations के साथ उनका role भी इसमें clarify करना होगा, because they are like a bridge, a setu between the citizens and between the schemes of the government. और मुझे लगता है कि जब तक हम civil society organizations का role include नहीं करेंगे, incorporate नहीं करेंगे, तो वो GO NGO coordination की जो हम बात कर रहे हैं, वो तभी successful होगा when we bring in the role of civil society. That is one precondition. Second is people must be aware. Entitlement education की जो हम बात करेंगे, people must be aware that this scheme में मैं हकदार बन सकती हूँ, इस facility के लिए मुझे फलाने के पास जाना है. I don't have to do चक्कर काटोइंग across so many departments, so many agencies, such that I feel that मेरा time निकल गया, या मेरा जो daily wages है, that I have lost just because I did not know the right person. ये तो citizen की बात रही, but also important is उस जिले में जहां पर social protection scheme हो रहा है, वहां we have to look at coordination at both the block level where implementation होगा and aggregation at the district level across, because उनको मालूम होना है कि उनके क्षेत्र में कौन-कौन eligible है. And of course the interface between that beneficiary or that citizen with the government, ताकि स्कीम उनको जाए जिसके लिए जरूरी है। एंड आई नो दैट ड्यूरिंग द पैंडेमिक बहुत सारे स्कीम्स को स्कोप बढ़ाया गया है। वी हैव एडेड मोर कैटेगरीज लाइक वन फेनोमेनन वाज ऑर्फन एंड वल्नरेबल चिल्ड्रन, जो कि कोविड के दौरान बढ़ गया था। वी सॉ इट इन महाराष्ट्र, वी आर सीइंग इट इन रेस्ट ऑफ द कंट्री। इसके लिए कई एग्जिस्टिंग स्कीम्स का स्कोप भी बढ़ाया गया, बट जब तक उन ऑर्फन्स को ये नहीं मालूम है कि हम इसमें शामिल हो सकते हैं, we will never get this interface right. So I think this is the whole purpose of bringing about the social protection consortium, ताकि we can bring about the parameters of a conducive enabling environment for social protection, और वो बहुत जरूरी है। And I think UNICEF has a mandate, क्योंकि जैसे आप सबको मालूम होगा ही we work in cycles of 5 years, और हमारा next cycle जो है 2023 से लेके 2027 तक है, जिसमें हम भारत सरकार के साथ we're trying to reach all children including adolescents through universal, child, gender sensitive and shock responsive social protection programs. So इसमें right from the life cycle, जबकि बच्चा जन्म लेता है, to the early childhood development, to education, to nutrition until the child reaches an adult, इस सारे life cycle में जो जो schemes है, mapping them and ensuring कि जिसको पहुंचना है वो पहुंच रहा है कि नहीं, and this is where strengthening of government capacity भी बहुत जरूरी है. So this is why this consortium idea is good, because हमने भी काफी evidence generate किया है through our first consultation, जो जिसका जिक्र रोशनी ने किया था in February 2022, where we looked at a consultation on building convergence for social protection. और इस मीटिंग में ये आइडिया निकल कर आया that why don't we form a small core group to facilitate this further. And I think today's meeting as a continuation में यही process को आगे ले जाने का मकसद है, जिसमें खास तौर से there are 3 things that we would like to see happen. One, of course, there are different presentations from different speakers to understand how do you reach the last mile, and उस last mile में reach करने के लिए क्या-क्या challenges हो सकते हैं, and what are the role of different stakeholders, कभी सरकार के होंगे, कभी civil society, या कभी citizens का भी हो सकता है. So it is a clear understanding of who is involved, for what and where. This is number 1. I think number 2 is how do we streamline the local administration, especially जहां तक हम urban areas की बात करें या tribal and rural. I think the pattern changes depending on the topography. जहां तक rural and tribal की बात है, I think there is a system that is functioning not just for social protection, for health, nutrition, water supply, education. इसके लिए एक ढांचा है. But when you come to urban, ये ढांचा ही अभी नहीं है, या है तो it is not recognizable. I think we have to look at this across the board and see how can we promote and strengthen that local administration ताकि वो sensitive बन जाए towards social protection. And lastly, how do we advocate as a consortium members to bring it to the policy table कि अगर इसको हम social protection को institutionalize करेंगे with the sole objective कि we reach out to those who are in the last mile, and the last mile is always a very long mile mostly, but sometimes a last mile is right below our nose. मैं जिक्र कर रही हूँ, for example, you know, when we talk of children of construction workers, and we have CREDAI as an agency across not only Maharashtra but across India, which is Construction Real Estate Development Association of India. They run construction sites, but उनके जो बच्चे रहते हैं, उनको ना तो health की facility है, ना school की, ना nutrition की, ना health checkup की, or of a safe environment. Social protection even comes here. And by the way, just in Pune, इसीलिए मैं कह रही हूँ, कभी-कभी last mile is very long, but कभी-कभी last mile is very close to us. हम बॉम्बे में हैं और मैं पुणे की जिक्र कर रही हूँ, जहाँ की करीब 30,000 ऐसे बच्चे पुणे में ही मिलेंगे जो जिनके माँ बाप construction workers हैं and who are not getting the benefit of any of the social protection schemes. Even if you make a small dent here, it will make a big impact across the state. So I think this consultation is to look at what could be your contributions in building up this strategy, and I would really look forward कि इसके बाद हम कुछ concrete outcomes लेकर आएंगे जो कि हम उसको आगे बढ़ा सकते हैं. So with that, I would like to conclude and thank you for your patience. Thank you.
Thank you so much, Rajeshwari. I think आपने बहुत ही अच्छे तरीके से both वो leave no one behind का concept का जिक्र किया, but also the universalization across the life cycle. I think ये बहुत necessary है. And again, आज का जो meeting है, it's just a beginning. I think, really moving forward in that sense. We are really excited now to start the panel, which is the main piece of today's consultation. जिसमें we are really going to hear grassroots experiences. कि अलग अलग स्टेट की जगह से क्या हो रहा है सोशल प्रोटेक्शन फैसिलिटेशन के लिए. एंड फॉर दैट आई वुड लाइक टू वेलकम अनुराधा नायर फ्रॉम यूनिसेफ, हु इज द सोशल पॉलिसी स्पेशलिस्ट एट महाराष्ट्र यूनिसेफ. एंड अनुराधा का बहुत ही एक बड़ा रोल है ये पूरे सोशल प्रोटेक्शन, सोशल पॉलिसी के जो भी इंटरवेंशंस हो रहे, जो भी एडवोकेसी हो रहा है स्टेट में, उसको थोड़ा एक तरीके से कन्वर्ज करने में उनका बहुत ही एक इम्पोर्टेंट रोल रहा है. सो वेरी हैप्पी टू हैव यू हियर अनुराधा, एंड I think she's a driving force behind the consortium as well. So welcome, Anu, and over to you to moderate and introduce the panelists.
Yeah, thanks, Roshni, and thanks, Rajeshwari. So I think it's very clear from the conversation that we've had, what we heard just now is that the success of social protection really depends on the effective administration of adequate design. Now, despite a plethora of well-designed tools from the government and a large presence of government functionaries at all levels, we know that the benefits of the schemes do not often reach the vulnerable poor and the families. We are moving to so with that background, which sort of reiterated from Rajeshwari's conversation, we are moving to the next segment of today's workshop, which is about exploring various approaches and models for facilitating last mile access in diverse contexts and by diverse stakeholders. So we know that there are a good number of grassroots level organizations working for creating awareness and supporting vulnerable people with application processes of social protection. And post-pandemic, the volume of this work increased, and organizations working on develop, there are unique models created around it in terms of expanding the access to social protection. So our aim today is to understand this model, how they are functioning, the challenges and learnings within that, and create a kind of advocacy strategy, a very comprehensive note around it, which can then be used for advocacy with the government in terms of looking at entry points there. So with that, let me introduce our panelists for this session. Roshni, yeah. So we have Amit Narkar, he's the CEO of Arohan. He works mainly on the issues of development and governance from the lens of the marginalized people. We have Ashwini Kulkarni from Pragati Abhiyan. Pragati works with communities to make government programs and accessible, and it's also part of various alliances, including the National Network on MREGA. Our third panelist is Divya from Ajivika Bureau. She leads the Bureau's policy and partnership work, engaging with a range of stakeholders from industry to government. We have Dr. Rama from Roshni. Can you move it? Yeah. We have Dr. Rama from Sneha. She's the director of Sneha's Adolescent Health and Sexuality Education Program. Our fifth panelist is Madhura Karnik from Hagdarship. She leads the growth vertical at Hagdarship, which includes sales, marketing, communications, client servicing, and impact measurement. And finally, we have Marina from YUVA. She is associate director at YUVA, and she has been working on issues of urbanization, labor, and habitat. She has been closely associated with the UNICEF YUVA partnership for improving social protection programming in the state. Given the paucity of time, we had to limit the number of presentations, but we are sure that others will contribute through their inputs by making points to the chat or speak if time permits. Each panelist will speak about, say, 8 minutes, presenting their model, their functioning, challenges, and learnings. And going forward, we'll see how to synthesize these learnings. Without much further ado, let me hand over the floor to our first panelist. Over to you, Amit.
Yeah, can you hear me?
Yes, we can hear you.
Thank you very much, YUVA and UNICEF, for organizing this very important conversation around social protection, especially in the post-pandemic situation. And also thanks for giving us the opportunity to present our experiences on ground. I'll be speaking largely on the basis of experiences of working with the tribal communities in Palghar district, and that too largely in Mokhara block, because that is the place where we have been working since 2005-6. We started off as a project of the Social Work College of Nirmala Niketan, when there was a news in the media of 169 tribal children dying due to malnutrition in Mokhada and Jawar blocks. So a project was started to intervene and address the issue of malnutrition in that area. And naturally, as it happens, malnutrition is just one part of the problem. The fundamental problem lies somewhere else, and that is mainly in the historical exploitation that the tribal communities go through, along with distress migration, lack of livelihood opportunities, etc., etc. So Arun naturally started working on addressing all these issues, and now after the last 15 years, the rich experience that we have has taught us many things, where we had to change the way we functioned, adopt new strategies, and then also look for strategies which will in a way take the entire community and the entire administration to a more and more convergence approach. We have been fairly successful in some of our interventions. There have been challenges. There are newer challenges every day. But I'll try and present our experiences with the help of 2 or 3 examples. So when we started working here in the Mokhada block, and when we expand our activities into different areas, so gradually our activities are basically into education, water conservation and agriculture and livelihoods, health and nutrition, which also includes early childhood care. And then there is one major vertical which we think is at the core of all other things, that is governance. And using this lens of governance, and where we say that governance basically means it's the governance should be transparent, accountable, and it should be participatory. Because ultimately it's people's empowerment which really matters. Because if we try to understand how this entire thing plays out when it comes to social protection or implementation of any government schemes, it's basically, on one hand, we have I don't like to use the word beneficiaries. It's basically the rights holders or entitlement holders. This is one major section. The other is the service providers or the duty bearers who have a duty to provide services to the rights holders. And then there is community, the larger people section, which do not necessarily constitute the rights holders or entitlement holders, but they are the people at large, and which within those people category the rights and entitlement holders operate. So these are the 3 major stakeholders, if you want to use the word. How do we actually work with these different stakeholders, and then what roles these stakeholders can play in ensuring that services are delivered to the rights holders and the schemes actually are run the way they are supposed to run. So I'm going to take help of 1 or 2 case studies. One thing what we have done in our area is our approach has been to work with the people. So when we are working with the rights or entitlement holders, our approach is basically to make them aware of what they are entitled to, build their capacities and work with them, support them whenever it is required. When it comes to these service providers or duty bearers, we also work with that institution, and we try to build their capacities, because you have Anganwadi workers, you have Asha workers, you have Gram Sevaks, then you have Talatis, you have Rozgar Sevaks. So a whole lot of government machinery right down to the hamlet level you have. So try to build the capacities of the service providers. At the same time, you also have to do advocacy with them to ensure that they provide the services to the entitlement holders. And then there are people, the community at large, where you have to build an awareness about what the community and different sections within the community are entitled. And there are many statutory institutions, statutory bodies, like you have the Village Health, Nutrition and Sanitation Committee. Then you have a Mata Samiti, which is at the Anganwadi level. At the school level, you have school management committee. So a whole lot of community-based statutory I would say monitoring oversight committees are there. So you also have to work with them and build their capacities, build their understanding, and provide help to them, provide support to them whenever it is necessary. So while doing all these things, there are always instances of confrontation with the official machinery. And if being NGOs, you are also working with the machinery, and you also have to confront the machinery, then that becomes a bit of a problem for organizations like us. So how we have tried to address this entire the contradiction, or I would say the conflicting situation. So what we have done is, under our governance vertical, where we say that ultimately it's the people who have to decide the course of their development, and so people need to be empowered in this process. So apart from working in the villages and ensuring that services are provided to the people, we also have built a structure which we call as the Pada Samiti. It is the tribal hamlet level committee of the local people. Those Pada Samitis, at every hamlet we have this Pada Samiti, which is made up of the local people. And that Pada Samiti, it is trained over a period of, let's say, 1 year, 2 years, on various issues, various development issues. They're also given information about various government schemes and programs. They're also educated about different legislation, and the space for people at the hamlet level or the Gram Panchayat, where the responsibilities really need to be shouldered, and our role needs to be played. So we build the capacity of the Pada Samiti members, and then we expect them to identify issues which they feel are important and need to be addressed at the village level. And then we also facilitate a process whereby we take these Pada Samiti people to the taluka level offices and ensure that a dialogue happens between the block level officials and the Pada Samiti members. So there are introductory dialogues in which it's just exchanging pleasantries and trying to understand what the taluka government offices are trying to do, and also gives an opportunity for the Pada Samiti members to actually go and see how a taluka office functions. And then gradually, when these people start identifying the issues at the hamlet level, then they prepare a chart of demands. They submit it to the Gram Panchayat, submit it to the block level officials, the appropriate agency, so to say. And then we also have what we call as the Pada Samiti block level taluka. Apart from taluka office visits, we also have taluka level review meetings, where the people have already submitted the issues to the taluka level offices, but if the issues were not resolved, then there were review meetings held at the taluka level offices, and then many issues were discussed in those meetings, and then somewhere the wheels started turning. So now, I mean, we have been working largely on health, so I'll come to health a little later. But one interesting which we did, and this is a very recent example. There is a government program by the name Shasan Apल्या Dari, government at your doorstep. तो उसमें ये होता है कि गवर्नमेंट की अलग अलग स्कीम्स की जानकारी लोगों को मिले, इसलिए हर एक गांव में गवर्नमेंट के ऑफिशियल्स जाते हैं, उनको जानकारी देते हैं, और जहां जहां पे वो फैसिलिटेट करने की जरूरत है तो उसको फैसिलिटेट करने की कोशिश करते हैं. तो गवर्नमेंट ने कुछ ऐसे ही शासन आपल्या दारी के उपक्रम हमारे एरिया में किए थे, जहां पे मेजर इशू स्पेशली इन द ट्राइबल एरियाज इज द लैक ऑफ नेसेसरी डॉक्यूमेंट्स. जैसे आपको अगर किसी स्कीम का बेनिफिट लेना है तो आपको डॉक्यूमेंट्स देने होंगे, और अगर आपके पास डॉक्यूमेंट नहीं है तो आपको बेनिफिट नहीं दिया जाएगा. So there are very basic documents like Aadhaar is almost mandatory for all these schemes. तो लोगों के पास आधार कार्ड नहीं है, बहुत सारे लोगों के पास रेशन कार्ड नहीं होता है. Then you don't have the bank accounts, you don't have any identity proofs, so बैंक अकाउंट ओपन नहीं होता है. So in many instances you need income certificate, वो आसानी से नहीं मिलता है. Then for higher education you need the caste certificate, the tribe certificate, वो भी आसानी से नहीं मिलता है. So you have to apply for these things and then you have to wait perpetually. तो शासन आपल्या दारी में ये भी एक मकसद था कि ये सारे इश्यूज को एड्रेस किया जाए. तो वहां पे शासन आपल्या दारी हमारे एरिया में हुआ, लेकिन लोगों का उसको जितना रिस्पांस मिलना चाहिए था उतना रिस्पांस नहीं मिला. सो दिस हैपेंड सम आई गेस 2 or 3 years ago. और तब कुछ लोगों ने अपने अपने एप्लीकेशंस किए थे जो डॉक्यूमेंट्स उनको चाहिए थे उसके बारे में, लेकिन वो डॉक्यूमेंट्स उन लोगों को अब तक नहीं मिले थे. तो when we started discussing issues in the पाड़ा समिति meetings, तो पाड़ा समिति ने आइडेंटिफाई किया, उन्होंने कुछ 170 अलग अलग इश्यूज आइडेंटिफाई किए थे अलग अलग पाड़ा समितियों ने। तो इन 170 में से हमको ये दिखाई दिया कि दिस लैक ऑफ डॉक्यूमेंट्स इज एवरीवेयर। तो उसको अगर आइडेंटिफाई करके प्रायोरिटी पे उसको हैंडल करते हैं तो उसके लिए हम कुछ कर सकते हैं। So we also pleaded with the taluka level officials, and then they said we will be doing these things and those things, so let people come to us and we will help them out. But naturally, a tribal person traveling from a hamlet to Mokhada block, submitting his applications and then visiting the office for 3-4 times, that doesn't make sense for a daily wage earner. So naturally people lose interest. So what we decided that we will organize these camps, the documentation facilitation camps. तो ये हम लोगों ने पाड़ा समितियों के साथ भी डिस्कशन किया, तो उनको भी ये आइडिया अच्छा लगा. Then we also discussed with the block level officials, and thankfully the Mokhada Tehsildar and other people they were very much welcoming of this suggestion. तो उन्होंने कहा कि आप लोग ऑर्गेनाइज करो, we will ensure कि हमारे लोग वहां पे आ जाएंगे. तो इस तरह से हम लोगों ने कुछ अलग अलग पहाड़ों पे हम लोगों ने कैंप्स ऑर्गेनाइज किए, और उसमें हम लोगों ने जो काम किया तो उसमें बहुत सारे लोगों को इनकम सर्टिफिकेट, आधार कार्ड इन लोगों के पास उनको नए भी देने का काम हुआ. उसके साथ साथ कुछ लोगों के अपडेट करने थे, उसको भी अपडेट करने का काम हुआ. बहुत सारे लोगों ने एप्लीकेशंस गवर्नमेंट के शासन अपनादारी उपक्रम में किए थे, तो 2 साल गुजरने के बाद भी उनको सर्टिफिकेट्स नहीं मिले थे. So when we started organizing these camps, people were a bit hesitant in the beginning. और वो कह रहे थे कि हम लोगों ने तो 2 साल पहले किया है, अब तक तो कुछ मिला नहीं है, तो आप करेंगे तो उससे मिलेगा क्या? So there was a lot of hesitation also. But somehow, since we have this network of पाड़ा समितिस, we were able to convince people कि एक बार करके देखते हैं. और हम लोगों ने एश्योरेंस भी दिया, पता नहीं कहाँ से दिया, लेकिन हम लोगों ने एश्योरेंस भी दिया कि अगर हमारे कैंप से आप लोग करते हो तो यहाँ से जरूर आपको डॉक्यूमेंट मिलेगा. और उसमें भी मतलब when we moved forward in this, तो ये पता चला कि it's not very easy, लेकिन continuous pleading with the block level officials, we could get the certificates. तो जिन लोगों के मन में एक hesitation था, उनका hesitation कम हो गया. And then we actually in एक 7 गवर्नमेंट कैंप्स हम लोगों ने किए थे. उसमें 222 कास्ट सर्टिफिकेट्स, 222 कास्ट सर्टिफिकेट्स, 156 income certificates and 160 Aadhaar cards. So these were all, we were able to issue these certificates to the people. अब ये भी डिमांड आ रही है कि जो पुराने गवर्नमेंट के पास पेंडिंग पड़े थे, तो उसके लिए भी नए सिरे से हम लोग ये कैंप ऑर्गेनाइज करें, और उसमें हम लोग अगर नए से करते हैं तो people are willing to submit the documents afresh, and then we can work with the taluka level officials and then ensure that the people get these documents. तो इसमें चैलेंजेस तो बहुत हैं, जैसे कि वर्किंग विथ पीपल, तो लोगों को कन्विंस करना कि ये असल में हो सकता है, क्योंकि पीपल हैव ऑलमोस्ट लॉस्ट कॉन्फिडेंस कि गवर्नमेंट मशीनरी के पास जाएंगे तो हमको कुछ मिलेगा. तो रीबिल्डिंग दैट कॉन्फिडेंस, दैट इज एसेंशियल. सेकंड थिंग इज हैविंग अ लोकल लेवल नेटवर्क ऑफ पीपल हु आर नॉट पार्ट एसेंशियली ऑफ द एनजीओ. तो एक तरह से लोगों का एक संगठन वहां पे बने. मे बी देयर आर अदर पॉलिटिकल पार्टीज, अदर पॉलिटिकल ग्रुप्स, but apart from that, some non-political, or let's say beyond any political affiliations, if there is some mobilization of people, that really helps. और जो पाड़ा समिति हम लोगों ने की है, तो I think that really has been able to play the role. So this is one example, where the government officials have been forthcoming, where we didn't have much of the confrontation. But in other areas, like we also worked on this, Narega. I'm not going to speak more on Narega because Ashwini is already there, and she will speak more about it with more authority. But what we have done in our areas is actually, ensuring that people get job cards. Then we also prepare labor budgets. And once we prepare labor budgets, we also follow up with the government officials. And then the difficult part enters. And that difficult part is, लोग तो काम तो करते हैं, लेकिन लोगों को उसका जो वेजेस है वो 2-2, 3-3 साल तक नहीं मिलता है. तो उसके लिए then you have to really advocate in different ways with the government officials. And at the taluka level you have video on one hand, you have the tehsildar on the other hand. So you really need to understand what is the division of responsibilities between these two functionaries. And then accordingly you also have to train your pada samiti members. कि कौन सा इशू है तो किसके पास लेके जाना है. So so when it comes to implementation of certain government schemes where the performance of the block level officials is very much dependent on basic things like documents, then they are very much forthcoming. But when it comes to actual delivery of certain services, then there are a lot of instances of confrontation. So this NREGA वाला जो thing है, वहां पे हम लोगों को बहुत सारा confrontation करना पड़ा. इसमें भी I must say that we have these job card holders and we also have the Pada Samiti members who take up these issues, and we just facilitate an interaction, a dialogue between the people and the government offices. So this is another instance. The third instance, which I would like to speak a little about.
We have short over time, so we need to conclude now.
Okay. So just one instance, and I'll stop. In health, we work with the Anganwadis, और आंगनवाड़ियों के साथ काम करते हुए we also do the growth monitoring. Now this is an open secret. Government के जो SAM, MAM लोगों के जो आंकड़े होते हैं बच्चों के, that is pretty much under reporting. हम लोग जब each and every आंगनवाड़ी के साथ हम लोग जब काम करते हैं, growth monitoring करते हैं, तो हमारे आंकड़े बहुत बड़े होते हैं. So in one of the meetings we presented our statistics, and then there was a sort of dictate given to the block level machinery that NGOs should not be permitted to do growth monitoring in the Anganwadis. And then probably this that put all our work in jeopardy. क्योंकि हम लोग तो आंगनवाड़ी के साथ काम करते हैं, लेकिन जब इस तरह का डेटा आता है कि which can become politically uncomfortable for the government officers, then naturally there is some kind of resistance from their side, और उसको थोड़ा सा हमको दूर करने के लिए we will have to adopt different strategies. So there are different instances where people lack of awareness among people. There are many issues where you feel challenges of organizing, mobilizing people. There are challenges while working with the machinery, even though you try to build their capacities, help them out, but when it comes to certain difficult questions, then the government machinery, there you have to confront them. So these are some of the instances. I'm sorry if I have overstepped my time. Thank you very much for this opportunity.
Thanks, Amit. Thanks for sharing this enabling work that you have done in Mukhada tribal block, where you have mentioned the 3 instances where you have created a model of stakeholder engagement, both from right holders and duty bearers perspective. And I think one element that is coming very clearly is the capacity building that you have done with the Pada Samitis and the interface that you have created of Pada Samitis with the government officials. Also, in terms of when you face with the situation, how you have also looked at organizing camps in terms of dealing with the challenges, especially for the entitlements, access to entitlement elements. You also highlighted the challenges in the 3 instances, and I think we have some lessons to pick up from there. Without wasting any more time, I am now handing it over to Ashwini for sharing her work. Over to you, Ashwini. Thanks, Amit, again.
Yeah, thanks for this special social protection webinar. We do need these kind of programs. I would like to share our experiences regarding NREGA. And I belong to a network called NREGA Consortium, National NREGA Consortium, and I will share experiences of those over last 10-15 years or so. So these are examples of how collective efforts could bring in some basic changes which have remained so till now. Just to get a feel of how big MGNREJ is, if we try and see how much it has spent over since its starting in 2006 till date, we have spent more than 8,48,000 crores in the villages. And as of today, there are more than 82 lakh people working on NREGA sites, though this is Kharif season. So people are busy with their farming, yet we find around 83 lakh labor working in the under MG NREGA. So that's the strength of NREGA. Now, what happened is when NREGA came in, there was a lot of things happening. Maharashtra was experienced, but Maharashtra had its own different type of problems, and all other states were also struggling to bring in the kind of implementation that is required. Though the act and the guidelines were pretty good enough to start with, there were a lot of things that were happening. So what we did as NGO partners across 11 states, which was initiated by Samaj Pragati Sahyog in Madhya Pradesh, we formed a NREGA consortium of organizations across, and we were like 72 partners across 11 states, which like almost more than 58 or 60 backward districts included in it. So what was the entire effort? Entire effort was that if there are organizations working at the ground level, we are getting a direct feedback of what is happening in terms of implementation of this at the grassroots level. So we tried to document experiences of all these organizations in their state, in their villages, in their blocks, in their districts, and try to understand what are the learnings, what are the insights. And of course, they were so varied, so different across different states. So we prepared first district level reports and then state level reports. There are two things to this. One is, how is the implementation happening? What is the process of implementation? Are there problems in getting job cards? Are there problems in putting demand? Are there problems in getting work sanctioned, work started, wages? All those issues were there. Suddenly in 2010, wage payments through bank came in. A lot of changes took place. I mean, there were times that ministry from Delhi used to send circulars like almost 3 times a week and asking changes to happen at the ground level. That doesn't work. So we were trying to monitor all this. What is central government saying? What are state governments able to do? What are the state governments' capacities to deliver? So we were trying to learn all this from the partners in different states and prepare state level understanding and articulate it into a document. Now with this, we also realize that it's not just a question of how it is getting implemented, but also a question of what kind of works, what kind of asset building, what kind of infrastructure is required in different places. So we were also working on the type of works. Earlier, the set was very small. And then we realized that, let's say, for example, spring shade was not part of the list of works allowed. But then Himalayan region organizations came up with this fantastic idea, and then we could incorporate that. So there were several such examples coming from the ground, which we could translate into bringing about the change in not just implementation processes, but also in the type of works that were being formulated. Now, so for the advocacy, what were the points is the learnings at the village level, block level, and the district level. How do we put it to the state? And what were the issues that could be resolved at different levels of administration? And what is it that requires policy implementation? Then for type of works, what are the resources required? And how does, why planning is so important? Just because the work has to start on demand within 15 days, that does not mean work should be ad hoc. There has to go in a good amount of planning to make good amount of infrastructure come up in the villages, which will help rainfed farming and create livelihoods. So while we were trying to understand all this, the kind of HR that is required, people that are required at Gram Sevak, Gram Panchayat to Secretariat. So all this we were learning and we were putting together. So what we did is create documents based on these experiences, and using those documents have consultations at the state level. And each consultation and each state had its own flavor. Like Bihar government was interested in understanding how MGNREG could be used for flood, not drought, but flood mitigation. That was Bihar's challenge. So while talking about what people's experiences were, we also came up with ways and means of what kind of programs, what kind of works to be taken up for flood mitigation in Bihar. Whereas Odisha was fighting distress migration. So we came up with ideas of what can be done, and it went from 100 to 150 days in Odisha in the early times to mitigate distress migration. So each state had its own theme in addition to the generic issues. Madhya Pradesh was more interested in how do we bring in convergence with agriculture department, forest department, social forestry, and others. So the report was based on these kind of themes. Jharkhand was more interested in watershed related works. Maharashtra had a different problem altogether, because we have had Employment Guarantee Act for a long time, for more than few decades before the central government one came in. There was a lot of confusion about, do we really need to change? And then when and where and how do we change? What are those things? So nothing much was happening in Maharashtra till 2008. So much so that 2008, Maharashtra was spending around 300-400 crores only, whereas our neighboring state, Andhra Pradesh, was spending this much amount in each district. So that is how we could see things were different in different states, and how the states were responding to what the central government was doing. One thing important to remember here is that most of the 95% of the funds are coming from central government. So states needed to buckle up to ensure that these funds reach the people who need it in the villages and build infrastructure. So we created these kind of consultations across states again and again, not just once, to see to it that implementation streamlines, improves, becomes more people friendly, and also create important infrastructure which is necessary for people living in those villages. Maharashtra, there is a very separate thing that one can put forward, but for the paucity of time, I'll stop here, but I can share those write-ups that we have on how Maharashtra changed. From 2008 to 2012, we moved from 300 crores to 200 crores with all consultation with the state government as well as local administration. So here, what NREJ consortium as partners, we were involved with central government in revising the guidelines, because the guidelines were prepared in 2007-8, and a lot of things had changed by then. So 2012, a committee was formed in the then planning commission, and we were part of the planning commission committee, which brought about new revised guidelines in 2013, which could bring in all these learnings and insights that we had learned from partners, which were grounded, and that we could bring that into the revised guidelines. Second thing that we brought in was the human resource requirement from Gram Panchayat to district mainly. That is where the implementation happens. That is where the last mile connectivity is. And then, so what kind of people do we need? We insisted that they should be locals. We insisted on trainings and what kind of training modules, all that, including the certification after the training, all that was designed through partners and presented to central government, which then National Institute of Rural Development in Hyderabad took it up as training modules. So we also came up with an idea called cluster facilitation team, where ultimately what we need is a space where organizations like ours who are grounded and who have insights can share those, give that feedback to the people who can bring about those changes in implementation, in policies, and recognize the problems. So we created something called cluster facilitation team, where a team of 3 people will help the local administration. These 3 people will belong to the local organization, CSO, and will help the local administration like Panchayat Samiti or Mandal in Andhra Pradesh to plan properly the kind of MGNREJ works that are required over a period of 3 years, so that we have a good shelf of works which can ensure good livelihood opportunities down the years. So this was implemented between 2014 to 17. Some of the states have continued with it. Maharashtra did not, but the states utilized this space very meaningfully and did a lot of value addition to the planning process, as well as the kind of works that are being put up under MGNREJ. Lastly, to come to our basic point of how do we institutionalize our experiences, I would like to put forward 2 things. One, we need to create a formal space where a bridge that that was said in the keywords, a bridge where formally instituted, where CSOs can have a dialogue with the authority so that we convey what is happening, and we converge, we bring in those energies to try and bring in changes that are required. In Maharashtra, for Narega, we have a government resolution which says that we can get into a non-financial agreement with district administration. If I'm working in that district, if our CSO is working in that district, we can have that arrangement with the district administration, and there will be regular meetings where we exchange our experiences and try to bring in the desired change. So this kind of a formal space where we can have a dialogue, and so the dialogue does not depend on the kind of officer that is sitting there, but it is more formalized, so that whoever is the officer, whoever is the person sitting there will have a place, and we can have a place to where we go and share our experiences. And before we do that, I think as CSOs also, we need to create our own database. We need to identify the problems more in more specific terms. We need to build the evidence around it. We can't just say something is happening in a particular block. Is it happening in 10 different blocks? Is it happening in 20 different blocks? Does it require to be fixed at the Panchayat Samiti level, or at the divisional commissioner level, or at the state level? So we need to build evidence to say what the specific problem is, where is it that the solution can be formed. We need to articulate all this, and we have to also come up with the likely solutions, because we are more closer to the possible solutions than an officer who could be sitting in a more far away place. And how do we bring about that consultation, that dialogue space, wherein we convey all that we have learned and follow it up to bring in the required change? This is possible, and this can be done. This can remain in the non-confrontationist milieu, and there will be a mixed response to this. Some states, some districts will be different from others, but there will be some minimum level of dialogue and which can bring about change as required from the point of view of people for whom the whole project and the program is meant. So I will stop here. Any questions, I will be happy to respond. Thank you.
Thank you, Ashwini. Very valid points in terms of as we move ahead with the Social Protection Consortium here. So for everyone, Ashwini shared about the importance of collective approach through narrating the efforts under the NREGA consortium, which is spread across different states. She highlighted the importance of, say, planning, advocacy, working around, she highlighted the importance of knowledge products created and using evidence-based consultations and continued dialoguing. That's where I think I am picking up points from what you mentioned, Ashwini. Also, I think in terms of creating, we reiterated the importance of creating a formal space for interface, geo interface. And I think your work around the consortium's work towards influencing the revision of NREGA guidelines, or even in terms of influencing capacity building for NREGA is commendable. Thank you, and we look forward to your continued inputs. And I now invite Divya from Ajivika Bureau for sharing the experience. Over to you, Divya.
Thank you. Thanks a lot, Anuradha. Can you hear me, and can you see my slides?
Yes, yes.
Yes, we can. Maybe you can put it in slideshow.
Yes. Yeah, thank you for this opportunity, and thank you for inviting me to this very important platform. मैं आजीविका ब्यूरो नाम की एक संस्था से हूँ, और हम लोग राजस्थान, गुजरात और महाराष्ट्र में काम करते हैं, और we work with a very specialized focus on vulnerable migrant workers. So in this webinar, I'll try to bring in some of our experiences in facilitating social protection and entitlements to this community, which, as all of us know, went through a lot of unprecedented kind of hardships during the COVID pandemic. And in the opening remarks, it was also highlighted very well by Madam Director. So just to start with a brief kind of a context, we all know that it's rising rural poverty and agriculture distress that is leading a lot of vulnerable migration into the urban labor markets, and which are also expanding and looking for very cheap labor. जो बिहार, उत्तर प्रदेश, झारखंड, उड़ीसा ऐसे स्टेट से बहुत लोग बहुत पैमाने में सिंगल मेल माइग्रेंट्स, फैमिलीज, बच्चों के साथ बहुत लोग आते हैं शहरों में, बहुत ही हार्डशिप्स में अलग अलग सेक्टर्स के बॉटम एंड में काम करते हैं. The key destination states are of course Gujarat, Maharashtra, Delhi and Karnataka, and we see very vulnerable kinds of migration which are both intra-state, where that is within state boundaries, as well as interstate and long distance kind of migration corridors. There are corridors that are established which has seen historical kind of migration, but also newer kind of corridors that see very emerging patterns in the country today. बहुत लोग वाकिफ होंगे कि माइग्रेंट वर्कर्स की क्या चैलेंजेस है, बट थोड़ा संक्षिप्त में बता रही हूँ, just to build context for the kind of challenges we encounter in facilitating social protection for this group. So it's a very seasonal, circular, temporary kind of workforce, and those are the the segment that form the most vulnerable of this broad umbrella of migrant workforce in the country, and when they are seasonal and circular, what happens is that they are a floating presence in the city. They are very mobile. They move from villages to cities on a temporary basis. खेती के टाइम पे वापस गांव चले जाते हैं, फेस्टिवल्स के टाइम पे चले जाते हैं, और शहर में भी जब वो आते हैं तो एक वर्क साइट से दूसरे वर्क साइट फ्रीक्वेंटली मूवमेंट रहता है उनका. एंड व्हाट दैट रियली रिजल्ट्स इन इज दैट देयर इज अ sheer absence of permanent shelters. There, even if they live in a settlement for many years together, those settlements are not really recognized by the urban local bodies. तो उससे क्या होता है कि documentary proof उनके पास होता नहीं है. There is no evidence for claim making in the city. Basically, there is no evidence to prove that they've been in the city for employment or for a certain number of years, based on which a claim can be made for any kind of state entitlements. And that's really the challenge in working with this workforce, in mobilizing them, because as practitioners on the ground we know that जब हम चले जाते हैं उनके साथ मीटिंग करने के लिए, एक दो मीटिंग में एक सेट लोग आते हैं, उसके बाद people also keep changing in a particular location. So that really magnifies the challenges related to mobilization of this this kind of the workforce. They also work in very informal and casual kind of work arrangements, which means that उनके पास कोई वर्क कॉन्ट्रैक्ट्स नहीं रहता. सोशल प्रोटेक्शन, सोशल सिक्योरिटी के पूरे आर्किटेक्चर के एम्बिट में वो लोग आते नहीं है. एम्प्लॉयर और एम्प्लॉई वर्कर के बीच में जो रिलेशनशिप एस्टैब्लिश करना जरूरी है वर्क एंटाइटलमेंट्स के लिए, वर्क राइट्स के लिए, एम्प्लॉयमेंट राइट्स के लिए, वो एस्टैब्लिश करना बहुत मुश्किल हो जाता है, because the whole system is very informal. The labor market itself is entrenched in informality. There are many contractors, labor agents between the last mile worker and the employer, which makes all of this very difficult. Urban exclusion is a very important dimension, in terms of accessing healthcare. Legal aid is an important issue because क्योंकि वो informal sector में काम करते हैं, there are rampant cases of denial of wages, non-payment of wages, accidents हो जाता है but compensation मिल नहीं पाता. So all of these things require a recourse to legal aid, and I would also urge that when we think about social protection, we also think about access to legal aid also as an important dimension of social protection, especially for the informal kind of workers that we're talking about. So it is really in this context, that we see vulnerabilities spread across the continuum of rural and urban areas. It's not just an urban issue, it's not just a rural issue, but these are migrants who are spread across, this vast continuum that exists in our country. And many of them migrate to cities without really a fixed aspiration to settle down in the cities. And that's what makes it more challenging, because there is not a steady pathway of aspirations that they're working towards. So it is in this context that Ajivika Bureau was established in 2005, and we work in both rural and urban spaces among vulnerable migrants, building up a community-based institutions that helps them take agency and ownership, and also provide comprehensive services to reduce their hardships. We are headquartered in Udaipur in Rajasthan, and we run 20 centers across both source areas, which is the sending areas, as well as in urban cities, which receives migrant workers in large numbers. तो rural areas में हम लोग 14 से 15 locations में migrants के साथ काम करते हैं. ग्रामीण इलाकों में ब्लॉक स्तर पर हमारा काम है, और शहरों में हम लोग अहमदाबाद, सूरत, मुंबई और पुणे में इन लोकेशंस पे इनफॉर्मल माइग्रेंट वर्कर्स के साथ काम करते हैं. तो मेन जो हमारा गोल्स है, इट्स रियली टू इम्प्रूव वर्क कंडीशंस in a very secure, dignified way for migrant workers, and making employers and local governments responsive to the conditions of migrants, because they contribute in such great amount to the economy of a city, and also to create a safe space where workers can come in and raise their grievances. तो मैं यहाँ पे 3 pathways highlight करना चाहती हूँ जो हमारे मॉडल के अहम भाग है, and maybe there are lessons for all of us in how to enable social protection for this kind of a mobile vulnerable category of workers. So one of the first elements of our model is that we run worker facilitation centers in high migration hotspots. So when I talk about hotspots, again, in both in the rural areas as well as in the cities where workers come to work. And these are walk-in kind of resource centers, and these are established in very strategic locations in terms of worker communities, like जो construction नाके होते हैं जहाँ पे लोग जाके सुबह खड़े रहते हैं काम की तलाश में, मंडियों के पास, रेलवे स्टेशंस के पास, ट्रांजिट एरियाज जो है बस स्टेशंस के पास, large work sites के सामने या labor colonies, labor settlements के सामने. So we choose strategic locations, especially in the cities, to establish these walk-in resource centers, which act as a safe space for workers to come in and get information, and get access to entitlements. So the functions of the worker facilitation center are really to impart information, counseling, skills to workers, enable linkages to critical kind of entitlements and government schemes, and that is really the operational node through which we empower and organize workers into worker unions and collectives. Of course, it leads to reduced risks and vulnerabilities for migrants, more livelihood opportunities, and overall enhancement of productivity in the ecosystem. तो इसमें जो strategy है, especially with respect to outreach, क्योंकि जो शहरों में urban slums में रहते हैं, उनसे एक marked difference है जिन strategy से हम migrant workers के साथ काम करते हैं, वो ये है कि a lot of the outreach actually happens in languages that are accessible to migrant workers. For example, हम लोग सूरत में एक करीबन 10 से 12 लाख उड़िया माइग्रेंट्स है जो सूरत में आके पावर लूम्स में काम करते हैं. तो हमारा सारा आउटरीच, हमारे पैम्फलेट्स, कम्युनिकेशन मटेरियल सब उड़िया लैंग्वेज में है. हमारी टीम में उड़िया कम्युनिटी के मेंबर्स है जो वो भाषा बोल सकते हैं, जो कि बहुत इंपॉर्टेंट है माइग्रेंट फॉर ट्रस्ट बिल्डिंग एंड रैपो बिल्डिंग. हमारे जो आउटरीच प्रोग्राम्स के टाइमिंग्स है वो माइग्रेंट्स के वर्क शेड्यूल से मिलता जुलता है. तो सुबह कंस्ट्रक्शन नाके पे जाके आउटरीच करना कंस्ट्रक्शन वर्कर्स के लिए, या इंडस्ट्रियल फैक्ट्री वर्कर्स के लिए शाम में जब वो काम से निकल के आते हैं तब उनके साथ रैपो बिल्डिंग करना. उनके कार्यस्थल पर जाते हैं तो बहुत ज्यादा बातचीत हो नहीं पाती, तो इसलिए हम लोग रेसिडेंशियल सेटलमेंट्स में हमारे काम को आउटरीच एफर्ट्स को फोकस करते हैं. सीजनैलिटी जो है, माइग्रेंट्स की सीजनैलिटी को मद्देनजर रखते हुए, जैसे होली और दिवाली के टाइम पे हमें पता है कि आदिवासी क्षेत्र से जो माइग्रेंट्स आते हैं वो बड़े पैमाने में अपने गांव वापस चले जाते हैं. तो हमारी टीम्स भी उस टाइम पे ग्रामीण क्षेत्रों में चले जाते हैं, वहां पे माइग्रेंट्स के साथ रैपो बिल्डिंग और एंटाइटलमेंट फैसिलिटेशन ग्रामीण क्षेत्रों में जाके करते हैं फॉर अर्बन एंटाइटलमेंट. सो वी अडॉप्ट रियली मेनी काइंड्स ऑफ चैनल्स थ्रू व्हिच वी कैन रीच आउट डायरेक्टली टू माइग्रेंट्स. वी आइडेंटिफाई वीकली हॉलिडेज इन डिफरेंट सेक्टर्स and focus our outreach efforts through that, and then we focus on entitlements that migrants can access, and most of these are central government schemes, because अभी भी इंटरस्टेट माइग्रेंट्स के लिए पोर्टेबिलिटी का एक बड़ा इशू है. तो इसलिए ई श्रम अभी जो निकला है अनऑर्गेनाइज्ड सेक्टर वर्कर्स के लिए, और वर्कर बेस्ड वर्कर एंटाइटलमेंट्स लाइक ESIC, उसका यूटिलाइजेशन रजिस्ट्रेशन, प्रोविडेंट फंड का बैलेंस अवेलेबल कराना, उसका यूटिलाइजेशन पे एडवाइस देना. फैसिलिटेटिंग बैंक अकाउंट्स इज अ बिग इशू बिकॉज दे डोंट हैव एनी domicile documents to prove their residence in the city. So opening bank accounts for them, legal aid awareness and occupational safety and health. एंड करेक्शन ऑफ डॉक्यूमेंट्स, क्योंकि आधार में जो स्पेलिंग मिस्टेक्स है उसकी वजह से जो अमित जी भी बता रहे थे, आई थिंक उसकी वजह से बहुत सारे एंटाइटलमेंट्स रुक जाते हैं. सो हेल्पिंग पीपल navigate through these kind of very technical but important unsurmountable challenges, I think, is an important objective for us. The second kind of pathway that I want to highlight is a labor line, which is a toll-free helpline that we are running in collaboration with the Labor Department in राजस्थान. तो ये लेबर लाइन का मुख्य जो उद्देश्य है वो ये है कि इट्स अ टोल फ्री नंबर वेयर वर्कर्स कैन कॉल इन, क्योंकि हमारे वॉक इन सेंटर्स पे आने के लिए कभी कभी ऐसा होता है कि वर्कर्स हैव टू टेक अ फुल डे ऑफ एंड फॉरगो देयर वेजेस. सो द existence of a phone-based counseling service, a phone-based assistance, really helps them just call in and register their grievances and seek kind of assistance. It is a toll-free number that works on, issues like non-payment of wages, accident compensation, abuse, bonded labor. A lot of these are rampant issues within the communities that we work with. And we all receive about 300 to 350 calls daily on this helpline. And this really exploded during the pandemic time when we were receiving about 1,000 calls per day on this helpline. We have about 5 phone lines, and we've so far facilitated compensation worth 38 crores of rupees for migrant workers. And this is important to note, because in the absence of such an initiative where there is no method of establishing employer-employee relationship, there is no evidentiary documents to prove that a denial of wages has happened. It is in such a condition that where it would have been entirely lost for workers that this initiative has been impactful. It's also an official authorized BOCW grievance redressal platform for workers. The Building and Other Construction Workers Welfare Board is an important landmark kind of a legislation that guarantees so many benefits to construction workers. So the helpline also acts as a means of facilitating entitlements under that scheme, helping with registration, addressing complaints, and enabling entitlements. The third kind of pathway that I want to highlight, and this is the last, is really collectivizing workers into unions that then get registered, especially in the destination states. And this strategy is especially important because migrants don't have voting rights in the cities, so they don't have any mechanism to hold the political parties accountable, the political actors accountable. There's no political leverage that they enjoy in the cities. So इस कंडीशन में हम लोग वर्कर्स को वर्कर कलेक्टिव्स के माध्यम से ऑर्गेनाइज करते हैं और उसको यूनियन के लेवल तक ले जाके अबाउट 7 ट्रेड यूनियंस हैव बीन रजिस्टर्ड नाउ इन सिटीज इन सेक्टर्स लाइक कंस्ट्रक्शन वर्कर्स, स्टोन वर्कर्स, हमाली का जो काम करते हैं, होटल वर्कर्स, ऑल ऑफ देम हैव बीन ऑर्गेनाइज्ड एंड वी फैसिलिटेटिंग दीज यूनियंस. द मेन ऑब्जेक्टिव अगेन हियर इज टू डिमांड राइट्स फ्रॉम द एम्प्लॉयर्स as well as do actual claim making and demand making with the urban local bodies. क्योंकि urban local bodies के सामने आप जाओगे, आप एक राजस्थानी प्रवासी श्रमिक हो जो अहमदाबाद में काम करते हैं, there is no visibility for them, there is no way to establish your identity, there is no way to claim that you are a legitimate presence in the city. So एक संगठन में ही शक्ति है, तो if you go as a union, then that has a very strong representational kind of an impact on especially when you're trying to advocate for benefits with an urban local body. So this is a case study, an example of how tribal migrants who were living in open spaces in the city, they had no access to toilets के लिए access नहीं था, पानी मिलता नहीं था, and public health facilities के लिए access नहीं था. And this was they were part of one of the unions that Ajivika Bureau had promoted called the Bandka Mazdoor Vikas Sangathan, and they undertook a survey of how many people lived in those areas, and the results of the survey was actually taken to the official in the Ahmedabad Municipal Corporation, demanding activation of these basic kind of services in that locality. So बहुत sustained advocacy के बाद 4 mobile toilets were installed in this. This is the mobile toilet that you see in the photo. 4 mobile toilets were installed for a cluster of about 200 migrant families. And the Ahmedabad Municipal Corporation started supplying drinking water twice a week in 3 migrant settlements. And they were also linked with public health facilities and ICDS and all of that. We have also now set up creches, I think to the point that was made in the opening remarks, early childcare for for children of migrant workers who really fall through the cracks when their parents are moving from villages to cities and moving through work sites. Creches were also set up in these open areas. So this was an example of how collectivization and demand making could really help in activating some of these services. And agar aap puchoge ki kya ye systemic level change tha, to maybe not. It was more of an altruistic or a benevolent action by one officer. But I think what happened was that it helped us set a precedent that such actions could be undertaken even for migrant workers who don't have domicile documents in the city, and provisions could be made within the system, and we use that to advocate for similar services in other parts of the city as well. And this also became a good foundation during the time of COVID, when ICDS, take home ration, food packets, immunization services, ration, all of this was activated for these communities who were living in the open spaces without any roof, as well as TB detection and diagnosis, which is an important issue for informal kind of workers. This is the last slide that we have. This is a niche kind of a case study regarding a success that we had with in advocating for more benefits for silicosis affected workers. These were not migrant workers, but these were informal workers in a cluster called Pindwada in Sirohi in Rajasthan. They undertake stone carving, like you can see in the photo, which when it is done through a machine, it leads to large amount of dust generation, and silicosis leads to certain death, and there is no real treatment that has been found out for this. So sustained years of advocacy as coalition of organizations, of worker organizations working in these areas, that really had some outcomes, which was that Pindwada, which was a hidden cluster, got added to the high silicosis prevalence areas. A pneumoconiosis board was established in each district, which really helped in detection, registration of silicosis patients and benefits. And as a result of, again, long years of advocacy, a pneumoconiosis prevention and rehabilitation policy was also launched in 2019 by the government, by the current government in Rajasthan, which ensured many benefits to workers on detection and until their death, and also after death to dependent family members. Prevention is still a very weak side. The challenge is to enforce regulation and prevention, but that is still a very weak side of implementation of this policy. But the rehabilitation of this has taken off in a good way. Similarly, silicosis also got recognized through ESIC as a disability for which workers could be eligible for pension. So which about 200 informal workers are currently kind of deriving monthly pension based on that. So these are just two examples of case studies where sustained advocacy through coalitions in very dire kind of situations have actually resulted in positive outcomes. Of course, a lot more needs to be done, but these are some encouraging examples that I wanted to highlight. Thank you again for the opportunity, and I'll look forward to questions.
Thank you, Divya. Thanks for sharing the inspiring work of Ajivika Bureau for the migrant workforce in the country. This is indeed a very challenging and complex space, actually. So even in terms of working around improving workers' condition or creating safe workspaces, it's not a very easy task. And you have sort of identified 2 or 3 thoughtful strategies around, the way that you have highlighted about the workers' facilitation centers in high migration hotspots, or the toll-free helpline, or the whole work around, collectivization, building unions and platforms for targeting destination sites. And the last slide, which really highlighted on silicosis, how silicosis is recognized now as a disability for and under pension benefits. Great work, and we have some real lessons to pick up from here. Now, because of the time constraints, and we are not going to spend more time at this point of time, we are now inviting, I understand Madhura needs to leave by 12. So I'm requesting Madhura from Hagdarshak to come on board. Over to you, Madhura, to share the experience.
Thanks, Anuradha, and hi everyone. Great to be on a panel where the focus is social protection. I'll quickly talk about Hagdarshak and not talk a lot about challenges really, because I think we've spoken a lot about them. I'm from Hagdarshak, and Hagdarshak is a 6.5-year-old startup that we call ourselves, and we are a private limited company. And we started with the main aim of connecting people with their entitlements, right? And I think it is very unfortunate that the pandemic had to force a lot of the industry to talk about social protection and entitlements schemes. But I think we've been working on it for the last 6.5 years, and this problem has been persistent since forever. The only difference was that the media started writing about it, and all of us sort of, there was a sudden movement that, oh, you know what, this problem is huge. Like I said, without actually talking a lot about challenges, because all the speakers before have exactly pinpointed that, I'm quickly trying to talk a bit about the Hagdarshak solution, and how that kind of tries to solve each of the problem point and the pain point that was brought out by the previous speakers. Just to put it in context, at Hagdarshak, we are not into policy or advocacy. What we've tried to decide is there are enough experts today in the community that are doing that, and we are happy to sort of collaborate with them. But what we have built ourselves is a solution for the end facilitation, right? I think a lot of problems today are purely on the time, effort, and money that a end citizen has to spend on identifying the scheme, identifying the documents needed for the scheme, going and applying for the scheme, and then taking up a follow-up. And post all that also, where do I go for grievance redressal? So what at Hagdarshak, what we've done is we have used technology and a cadre of community members to try and solve each of these issues. Social protection, from our perspective, is a very, very community-owned sort of activity. And apart from the PRIs and the government functionaries that today exist, the community needs to be accountable because they are the ones who are actually entitled for it. We have an app today that we developed when we started, where what we've done is we have digitized schemes on the app in the local state language for every state in India. That helps anyone who uses that app to identify schemes eligible for the end citizen, which means that a simple profile is made on the app, and the app shows you the list of schemes that you're eligible for within around 5 to 7 minutes in your local state language. And each of the scheme will show how to apply for it, what are the documents required, how does the form look like, who's the government official in the area. In very, very simple terms, we're trying to condense the GR into a very basic sort of one screen format. However, just doing that and leaving it at that did not yield a lot of results when we started our pilots in Pune. So what we decided was there needs to be a community champion. There needs to be someone from the community who is going to use this app and can take this app door to door and can do three things. One, help the citizen discover eligible schemes. Once the discovery has happened, explain to the citizen why it is important for them to apply for the schemes. Two, identify the gap in documentation, and I'll come to that a bit later. If there are documents missing that are critical for application, like Amit was pointing out some time back, then help this person to get that documentation done, get all these things in place, make that file, and go and apply for the scheme on behalf of the citizen. This is the work of that community person. And what this enables the end citizen to do is that there is someone from my community who I trust, who is today telling me what I'm eligible for. I can ensure that since this is just my neighbor, or I know this person from years, I can give them my documentation, or I can go with them to the government department. This person will also help the follow-ups. This person will also be the point of contact for all grievance redressals. And I think that is the main thing that we are focusing on and trying to solve. Over and above that, we are not into advocacy, we are not into policy, but what we think is that there are very, very basic challenges in just the access, right? And documentation becomes a large part of it. So today we are working in around 24 states in the country. We have trained over 14,000 such community agents called Hagdarshaks who use our app and who are helping these citizens unlock benefits. And we've reached 20 lakh families across our 6 years of work. Largely, we work with philanthropies and CSRs in sort of implementing what we do as programs. But the larger takeaway here is that what we have learned is that when I am empowering one person in the community to use our app and help 10 others, that becomes a very, very sustainable channel. Of course, since we are a private limited, we firmly believe that there has to be a citizen buy-in. So the people who are doing this, the community agents, the cadre that we are building needs to be incentivized. There can be institutional participation in that, or sometimes the citizens are willing to, pay a facilitation fee for what they are doing. But we are trying to institutionalize this entire process of access to entitlements as we would do today for a bill payment, or as we would do today to get grocery ordered at our house. So this is something that is extremely critical for Haqdarshak to build a service that is just focusing on delivery at the last mile. We are focused on ensuring that if someone needs even a basic PAN card to get something done, then our Haqdarshak agent will help them do that. Or if someone had applied for a widow pension 2 years ago, our Haqdarshak agent can solve that by liaising it with the block officers, with the administration. We have our own teams doing that. And we are not very, very agnostic, or we are very, very agnostic on the sectors that we work from. So on the app, what we have done is there are schemes across all thematic areas, right from documentation to worker schemes, to schemes for education, agriculture, schemes for micro businesses. And we are now trying to have other NGOs and other cadres use this app. In fact, we also work with a lot of Gram Sevaks. We work with a lot of SRLMs to train on this app so that they can take it ahead. One of the important things that we have learned, and one of the case studies I'll also talk about today, keeping in mind the time that we have, is that how documentation becomes at center of it, right? I think scheme application, scheme funding, are the funds enough? Is the scheme great? That's a very separate topic and we don't want to be experts in that. But what we're trying to say is that this basic documentation in terms of a ration card or a caste certificate or an income certificate, and the absence of this documentation, and to the level at which people are also exploiting each other and promising them to get this document done for 6,000, 7,000, 8,000 rupees in urban as well as rural areas. In Talasari, we have worked for the last 3.5 years in Maharashtra. And one of our projects, and we were working with the Larsen and Toubro Public Charitable Trust to ensure that there is massive convergence and saturations in villages that have the least human development index. And one of the things that we saw there is that most of the tribals were eligible for schemes that gave them livelihood, schemes that gave their children education, but they have not applied there because there is no caste certificate. For them, again, to sort of reiterate what Amit was saying, for them to walk from their hamlet to the block is a no-no. No one is going to spend an entire day doing that. The public infrastructure for travel is not great. So what we did was we had our cadre go door to door. We had them explain to them why a caste certificate is needed. We showed them the schemes that they're eligible for at any point, and at any point, any of us would be eligible for 20 to 25 schemes. And then we started applying for caste certificates as a massive level. Till date, we've been able to do 10 to 15 caste certificates in a couple of those villages and hamlets. And then the local administration reached out to us saying that, we want to expand this. And then we started working with the Gram Sevaks only as a facilitation service. Right. And I think that is where that is what is important today. At the ground level, how do we facilitate the application? How are we making things easy? If the government channels, including the CSCs, if the government channels, including the Gram Sevaks, are for some reason not focusing on schemes enough, then why not build this parallel cadre who can support them? How can we capacity build this cadre? How can we give them tools and technology access, empower them to use technology to make their things smarter? And with a lot of government departments now, what we're trying to do is integrate a lot of these applications on our app itself. So what happens is this agent or the Haqdarshak on the field doesn't have to go to 5 different government departments today or a channel. So she can use a Haqdarshak app and do the applications from their own. A second part, I think one of the things that one of the speakers brought about was monitoring and evaluation, and how do we track today? We've seen on the field that how some of the powerful elements in any village actually take apply, make fake profiles, apply for schemes, get the benefits to themselves. What is that mechanism that needs to be integrated with the government to sort of track an individual application? How do we build systems so that there is more accountability, and which is where we say that identify someone from the community. Don't take a third party in the community and have them do those things, because we are then seen as agents and touts. But we think that there are very, very basic problems, like, even explaining someone what is the difference between an Aadhaar seeding and an Aadhaar linking. Most of the times people don't know that. And if your bank account is not seeded to your Aadhaar card, you're not going to get the DBT, even if you're eligible, even if you have applied, even if your application is approved. If your basics sort of are not covered, then that benefit is not going to reach you. And we've seen that in many states where we worked with farmers for the Pradhan Mantri Kisan Mandhan scheme, that their names all showed on the government lists that are publicly available, but there was no money in the account. And then when we went back and investigated, we saw that their account was not seeded with their Aadhaar card. It was linked to their Aadhaar card, but the seeding was missing. And the farmers did not know that, and the bank officials did not care to even explain to them about that. So I think while a lot of us are working on policy advocacy, which is extremely critical, I think the focus also has to be on these basic infrastructure and awareness and enablement sort of facilities that are needed. So that if a government goes ahead and launches a scheme after getting this field intelligence, it can actually be implemented and actually reaches the cadre. Unfortunately, I just have 2 more minutes because I had a pre-scheduled call. I'm happy to sort of talk to others on this and would have been happy to sort of talk more, but I can see some questions there. So Anuradha, I will utilize those 2 minutes to answer those questions rather than talk more. And then happy to hear the next speaker.
Yes,
so thank you so much.
Yeah, thanks, Adra. I think it has also generated a good number of interest. You will see in the chat session, there are questions whether it's a free app, how can we get the details? But I think it's very clear to us that it is a digital transformation solution model connecting people with entitlements, and we need to see how we need to look at various entry points for it in terms of ensuring that every citizen has an access to it. So I think if you could just take those questions, Madhura, in terms of, the questions are, is it a free app or can that be given to the teams here? What is the interface for that, etc.
Definitely. I'm just going to answer some questions quickly and then move over to my call.
Maybe you can start with whether it is a free app.
So it is a free app. I have put a link on the chat box. This app on the Hagdarshak, on the Play Store is for anyone to use and understand. What our agents use is a slightly different app, and I'm happy to work with that sort of you have a different app for NGOs, different training for NGO cadres. I'm putting my email ID here, and again, happy to talk to anybody just because of the paucity of time. But the free app can be given to anyone in your community, and they can read, and that's just solving the awareness part, not the access part. The access part is solved by our agent app, which is only given to people who we train as Hagdarshaks, but can be anybody in the ecosystem.
I guess it's also in terms of, you did mention about interface with Mavim and NRLM, right? So yes. I think that is also, maybe we could look at, some of the partners here are also running social protection facilitation centers. So if, apart from engaging with the Gram Sevaks, you said there is a parallel unit that we should be considering. So how do we sort of engage with these centers as well? So there are opportunities, I think, that we can explore going forward.
Sure, definitely. I think definitely. Just giving these centers access to the app and just sort of training them on the basic schemes is a very, very low hanging fruit, and we can start from there. And then also with NRLMs, SRLMs, we've already trained them in Chhattisgarh, Madhya Pradesh, Punjab, Maharashtra. The SRLM cadres as Hagdarshaks. These women are doing great. They're also earning through this by charging the citizen a fee. There are set models that we have. So really looking forward to brainstorm on these. I'm very sorry, but it's just 12:01 and I have a
Thank you,
partner
Madhura.
meeting.
Thank you so
Thank you.
much. We'll be in touch. Now, I may now invite Dr. Rama from Sneha for sharing Sneha's experience in the social protection sphere. Over to you, Dr. Rama.
Thank you very much, Anuradha. Can you hear me?
Yes, we can hear you. We can see you.
Thank you. So I think without further ado, I will start sharing my screen. वैसे तो बहुत सारी चीज़ों पर बात हो चुकी है, तो उन पर ना जाते हुए सीधे हम आप सब बताइएगा कि आप लोगों को स्क्रीन दिख रहा है क्या?
या हम देख सकते हैं, लेकिन if you could, yeah, that's fine. Now it's, yeah.
अभी दिख रहा है?
Yes.
ठीक है। तो ये तो हमने बहुत अच्छे से संदर्भ हमारा जो आज का है वो बन चुका है कि हम क्यों सोशल प्रोटेक्शन की इतनी ज्यादा बात कर रहे हैं और इसकी जो पृष्ठभूमि रही है पैंडेमिक के दौरान और उससे पहले भी। बिल्कुल, this has come into the focus unfortunately during the pandemic. Unfortunately, the pandemic has raised the bar very high for access to social protection schemes. तो अभी अगर हम देखेंगे तो स्नेहा में हम इस पर क्यों इतना ज्यादा गौर करने के बारे में बात करते हैं, क्योंकि अगर हम सीधा स्वास्थ्य पर आ जाएंगे, हेल्थ एडवोकेसी की बात करेंगे, तो हम देखते हैं कि स्वास्थ्य जो है सिर्फ हमारा शरीर या उसमें जो बीमारियां उत्पन्न होती है या उसके लिए जो सुविधाएं चाहिए सिर्फ उस पर निर्भर नहीं करता है, बल्कि स्वास्थ्य एक ऐसी चीज है जिस पर कई सारे और कारणों का बहुत ज्यादा प्रभाव पड़ता है। सो इट्स रियली अबाउट लुकिंग एट द सोशल डिटर्मिनेंट्स ऑफ हेल्थ। और सोशल डिटर्मिनेंट्स ऑफ हेल्थ जब हम कहते हैं तो खास तौर पर ऐसे लोगों के लिए जो बिल्कुल ही अपने आप में, चाहे वो उनके इकोनॉमिक स्तर की वजह से या उनकी सामाजिक पहचान की वजह से, या जो हम इतनी ज्यादा विस्थापन की बात कर रहे थे या माइग्रेशन की बात कर रहे थे, उसकी वजह से उनकी जो वल्नरेबिलिटीज हैं या उनके लिए जो सुविधाएं उनको मुहैया कराई जानी चाहिए या उनकी जो लिविंग कंडीशंस है, जिस तरह से वो रहते हैं, उनकी आर्थिक स्थिति जो है, ये सारी चीजें हर एक इंसान के स्वास्थ्य पर असर डालता है। और इसीलिए जरूरी है कि हेल्थ एडवोकेसी में या स्वास्थ्य के लिए जो भी हम पैरवी करें उसमें हम कैसे, उसके परिप्रेक्ष्य में हम सोशल प्रोटेक्शन को या सामाजिक सुरक्षा को कैसे देखते हैं। So this is really the premise of our work at Sneha, where we look at health in a holistic manner and we really try and focus on the social determinants. So what are some of the emerging needs? तो ये कई सारे स्नेहा में हम बहुत ज्यादा फोकस ग्रुप डिस्कशंस करते रहते हैं। We are completely rooted in urban vulnerable communities across 7 municipal corporations around Bombay. तो दो चीजें जो निकल कर आ रही हैं, आप देखेंगे एक तरफ सोशल प्रोटेक्शन स्कीम से, दूसरी तरफ जो एग्जिस्टिंग सर्विसेज हैं, जो सुविधाएं अभी उपलब्ध हैं, उनमें भी काफी सारी दिक्कतें आती है। तो अगर हम शुरू करते हैं कि इस वक्त कौन सी सर्विसेज हैं जो उपलब्ध हैं, उसमें हम देखेंगे कि एक महिला आरोग्य समिति की जो पूरी योजना है, तो हम महिला आरोग्य समिति के ग्रुप्स हम बनाते हैं, हम कोशिश करते हैं कि बस्ती स्तर पे जो महिलाएं हैं वो इन आरोग्य समिति में शामिल हो, ताकि उनको सबसे पहले पता चले कि उनके अधिकार क्या है और वो किस तरह से अपने ही बस्ती में इन सुविधाओं को मुहैया कराने में सरकारी तंत्र के साथ सीधा बातचीत कर सके। तो इस पर हमारा काफी जोर होता है। दूसरी बात, एक चीज ये है कि जो प्राथमिक स्तर है उस पर हम करीब 20 साल से भी ज्यादा का अरसा है हम काम कर रहे हैं प्राथमिक स्तर पर। लेकिन अभी हम ये भी समझ रहे हैं कि पॉलिसी इन्फ्लुएंस जो है वो शायद तब तक नहीं हो पाएगा जब तक हम एक तंत्र में घुसकर उसके हायर ऑफिशियल्स के साथ बातचीत कायम ना करें। क्योंकि तब तक चीजें बदलती नहीं है और यू नो देयर इज एक्चुअली नो मूवमेंट विद पॉलिसी इम्प्लीमेंटेशन अनलेस देयर इज something as basic as an order given by the Secretary Health. So that is really the space which we are trying to, wherein we are trying to move the needle. तीसरी चीज ये है कि रेफरल सिस्टम, और रेफरल सिस्टम जब हम कह रहे हैं इसमें हम खास तौर पर मैटरनिटी रेफरल सिस्टम की बात करते हैं। तो मैटरनिटी रेफरल सिस्टम एक ऐसा सिस्टम है जिसके बारे में हम अभी थोड़ी देर में देखेंगे कि स्नेहा ने इस तंत्र के साथ कैसे काम किया है पब्लिक हेल्थ सिस्टम के साथ मिलकर। और इसमें एक बड़ा पहलू है कि जो सिस्टम में जो लोग हैं उनकी क्षमता हम कैसे बढ़ा सकते हैं। तो क्षमता बढ़ाना जो है वो सिर्फ कौशल्य को लेकर नहीं है, लेकिन सबसे पहला जो क्षमतावर्धक काम है वो है किसी के जहन पर काम करना, किसी के जहनियत पर काम करना, किसी के मानसिकता पर काम करना, ताकि वो समझे कि वो जिस भूमिका में है उस भूमिका में उनकी क्या क्षमता है, ताकि लोग जो आम नागरिक हैं वो उन तक पहुंच सके और उनको कैसे सुविधाएं मिल सके। इसके अलावा जब हम सोशल प्रोटेक्शन स्कीम्स की बात करते हैं तो कई लोगों ने आज बातचीत की है, उसको बार बार और दोहराने की जरूरत नहीं है। हम देख रहे हैं कि दस्तावेज ना होने के कारण, डॉक्यूमेंट ना होने के कारण किस तरह की असुविधाओं से लोगों को गुजरना पड़ता है। तो इसके लिए फैसिलिटेटिंग एक्सेस अगर हम कहते हैं उसका पहला पड़ाव होता है कि कोई पात्र है या अपात्र है। तो पात्रता निर्भर करता है कि किसी के पास दस्तावेज है, पहचान पत्र है या नहीं है। और इससे पहले जैसे दिव्या जी ने बात की और हक दर्शक से भी हमारे साथी ने जो बात की, मधुरा ने जो बात की, स्नेहा एक ऐसे आबादी के साथ काम करते हैं जो इनफॉर्मल अर्बन सेटलमेंट्स में रहते हैं और ज्यादातर ये लोग हैं जो भारत के एकदम अंदर के गांव से, रिमोट गांव से आने वाले लोग हैं जो शहरों में अपना रोजगार ढूंढने के लिए आते हैं। तो हमने देखा है इससे पहले भी और काफी अच्छी समझ हमारी बनी है कि इनके लिए पहचान को लेकर किस तरह की दिक्कतें आती है। तो स्नेहा में सोशल प्रोटेक्शन हेल्प डेस्क सर्विसेज हैं जिसके जरिए हम ये कोशिश करते हैं कि सबसे पहले डॉक्यूमेंट्स पर हम कैसे काम करें और उसके बाद हम स्कीम्स को कैसे देखें। तो आगे चलते हुए पता नहीं ये क्यों रुक गया है। हाँ, तो सबसे पहले हम हमारा पब्लिक सिस्टम्स पार्टनरशिप का जो मॉडल है उसको देखेंगे। पब्लिक सिस्टम्स पार्टनरशिप का जो हमारा मॉडल है ये शुरू हुआ था मैटरनल रेफरल सिस्टम को सशक्त बनाने के लिए। करीब 20 साल पहले ये काम शुरू हुआ था। अब जाके हम देख रहे हैं कि उस सिस्टम में क्या क्या बढ़िया तब्दीलियां आई हैं। तो इसके कुल मिलाकर इसके उद्देश्य यही रहे हैं कि जो पब्लिक हेल्थ सिस्टम है और जो ICDS का जो सिस्टम है उनका जो काम है, उनकी जो सुविधाएं हैं वो लोगों तक पहुंच सके। और दूसरी बात ये है कि जो रेफरल नेटवर्क अभी तक कायम हो पाया है 7 म्युनिसिपल कॉर्पोरेशन में, जिसमें बॉम्बे म्युनिसिपल कॉर्पोरेशन भी शामिल है, तो इसको हम और बड़े पैमाने पर दूसरे डिस्ट्रिक्ट्स तक कैसे लेके जा सके, गांव हो या शहर हो, यहाँ तक हम कैसे लेकर जा सके। दूसरा उद्देश्य ये है कि जो इस सिस्टम में जो हायर ऑफिशियल्स बैठे हैं उनके साथ हम बातचीत न केवल शुरू करें बल्कि रिश्ते कायम करें, ताकि जो दिक्कतें आती हैं उनको हम उसी वक्त उनका समाधान ढूंढ सके। तीसरी बात ये है कि जो महिला आरोग्य समिति, जो नेशनल हेल्थ मिशन के तहत एक योजना है जिसमें नागरिक, खासकर महिलाएं जो है पूरी तरह से इसमें अपना सहयोग देकर काम कर सकती हैं, उनको हम कैसे मजबूत करें और जहां जहां पर वो सुविधा, वो ग्रुप्स उपलब्ध नहीं है, वो ग्रुप्स नहीं बने हैं, वहां पर कैसे हम उनको बना सकें। तो ये हम करते कैसे हैं, रेफरल सिस्टम बनता कैसे है। तो रेफरल सिस्टम बनाने के लिए आप देखेंगे कि सबसे पहले हमें रिश्ते बनाने पड़ते हैं। तो हमने महसूस किया है कि सबसे बढ़िया तरीका है रिश्ते बनाने का कि हम अप्रिशिएटिव एक अप्रोच रखें, क्योंकि वैसे तो अगर हम देखेंगे एक बड़ा गैप जो हमें नजर आता है वो ये है कि कोई भी सरकारी तंत्र अगर है, एक मिसाल हम देना चाहते हैं, जैसे मान लीजिए हम लोग गैर सरकारी संस्थाओं में काम करते हैं या किसी कॉर्पोरेट में अगर कोई काम करते हैं, तो वहां पर एक ह्यूमन रिसोर्स डिपार्टमेंट होता है। ये ह्यूमन रिसोर्स डिपार्टमेंट क्या करते हैं? ये ह्यूमन रिसोर्स डिपार्टमेंट के लोग जो हैं, ये कम से कम इन चीजों का ख्याल रखते हैं कि जो एम्प्लॉई है, जो कर्मचारी हैं, उनकी सुविधा असुविधा क्या है, उनको कहाँ पर मदद की जरूरत है, कैसे वो खुशहाल तरीके से अपने अपने संस्थाओं में काम कर सकते हैं। ये सारी चीजें एक ह्यूमन रिसोर्स डिपार्टमेंट करता है। हमने ये महसूस किया है कि जो सरकारी तंत्र है, जो पब्लिक सिस्टम्स हैं, वहां पर इस तरह की ह्यूमन रिसोर्स डिपार्टमेंट वाली जो सुविधाएं होती है वो शायद उपलब्ध नहीं होती हैं, या इस तरह के काम की कोई तारीफ नहीं की जाती है, कोई हौसला अफजाई नहीं होता है। तो तब हमने महसूस किया कि सबसे पहले तो काम करने के लिए रिश्ते बनाना, लोगों का हौसला अफजाई करना जरूरी है, जो इस तरह के एक बहुत मुश्किल पब्लिक हेल्थ सिस्टम में काम करते हैं। इसके बाद इसका प्रोटोकॉल्स कैसे बनाया जा सकता है? प्रोटोकॉल्स के लिए हम देखते हैं कि स्टैंडर्ड।
Sorry to interrupt, please. We could just wind up in a minute.
That's not possible. Winding up in a minute is not possible. Maybe 3 minutes. I'll try very hard.
Okay.
Yeah. Thank you. तो रेफरल सिस्टम के बारे में स्टेप्स आप यहाँ पर देख सकते हैं कि किस तरह से हम करते हैं। प्रोटोकॉल्स की बात करते हैं। रेगुलर रेफरल मीटिंग्स होती हैं जिसमें सारे म्युनिसिपल कॉर्पोरेशंस साथ में आकर बातचीत करते हैं, ट्रबल शूटिंग करते हैं। इसमें सबसे बड़ा पहलू है कि हम किस तरह से डेटा को देखते हैं, क्योंकि हमारे पास अगर रेफरल सिस्टम में हेल्थ पोस्ट, मैटरनिटी होम्स और पेरिफेरल हॉस्पिटल शामिल होते हैं, लेकिन जरूरी होता है डेटा को देखना। डेटा में शामिल होता है कंप्लीट डॉक्यूमेंटेशन कि रेफरल स्लिप जो एक स्तर से, तो अगर रेफरल स्लिप को हेल्थ पोस्ट से मैटरनिटी होम में जाना है, मैटरनिटी होम से पेरिफेरल हॉस्पिटल में जाना है, तो वहां क्या क्या लिखित रूप में डॉक्यूमेंट किया जाता है वो बहुत जरूरी होता है। रेफर्ड केसेस की ट्रैकिंग बहुत जरूरी होती है, और अप्रोप्रिएट रेफरल हुआ है क्या, कि अगर कोई गर्भवती महिला है, उनको किस तरह की सर्विसेज की जरूरत पड़ती है, वो देखकर हम अप्रोप्रिएटली उनको तुरंत कैसे रेफर कर सकते हैं, क्योंकि यहाँ पर किसी की जान जोखिम में हो सकती है। तो इन सारी चीजों को मद्देनजर रखते हुए ये रेफरल सिस्टम चलता है। इसके अलावा दूसरा हमारा मॉडल है सोशल प्रोटेक्शन हेल्प डेस्क। सोशल प्रोटेक्शन हेल्प डेस्क में हम ये करते हैं, ये देखिए जो यूनिसेफ का ही सोशल प्रोटेक्शन का जो पूरा लाइफ कोर्स अप्रोच है, उसी में हमने पैकेज बनाया है अलग अलग स्कीम्स का। तो हम देखते हैं कि अलग अलग उम्र के पड़ाव में कौन कौन सी स्कीम्स पर स्नेहा काम करती हैं। तो इसमें हम प्रधानमंत्री मातृ वंदना योजना, जननी सुरक्षा योजना पर काम करते हैं, ICDS की स्कीम्स पर काम करते हैं जिसमें सुकन्या समृद्धि योजना भी शामिल है, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम और राष्ट्रीय किशोर स्वास्थ्य कार्यक्रम, इन दोनों पर हम काम करते हैं। ई श्रम कार्ड कैसे मुहैया कराना चाहिए, राशनिंग, पब्लिक डिस्ट्रीब्यूशन सिस्टम पर हम बहुत ज्यादा काम करते हैं। इसके अलावा महात्मा ज्योतिबा फुले जन आरोग्य योजना भी मुहैया कराने पर काम करते हैं। मनोधैर्य योजना स्पेशली फॉर सर्वाइवर्स ऑफ सेक्सुअल वायलेंस एंड रेप, और उसके अलावा निराधार योजना और अटल पेंशन योजना। तो हम ये करते कैसे हैं? इसके लिए सबसे पहले तो हमने देखा है कि लोगों में जानकारी ही नहीं है, और इसमें एक बड़ा मुद्दा जो हम सामने लाना चाहते हैं वो है कि पात्रता किस बलबूते पर निर्धारित होता है। तो हम देखते हैं कि इन स्कीम्स को, खासतौर पर राशन की स्कीम्स को अवेल करने के लिए ये माना जाता है कि एक परिवार का सालाना इनकम अगर 59,000 है, 59,000 है, तो ही उनकी पात्रता निर्धारित हो सकती है। So I think this is where our entry point should be if we are beginning to think of a consortium on access to social protection, because this kind of a level of income, 59,000 per year per family, is a complete no-brainer when it comes to assessing or ascertaining poverty levels of families. तो हमें लगता है कि ये सबसे बड़ा एक दिक्कत है जिस पर हमें काम करने की जरूरत है। तो एक तो हमने देखा कि शेयरिंग इंफॉर्मेशन विद पीपल, लोगों में जानकारी ही नहीं है। दूसरी बात जो सबने बताया है कि डॉक्यूमेंटेशन का सपोर्ट, हम लोगों से बात करते हैं, समझते हैं कि उनको कौन कौन से कागजात, कौन कौन से दस्तावेजों की जरूरत है, और वो फैसिलिटेट करने में मदद करते हैं। तीसरी बात, जो अलग अलग स्कीम्स हैं, ये अलग अलग स्कीम्स के लिए जो पब्लिक सिस्टम्स अकाउंटेबल हैं या जिम्मेदार हैं वो अलग अलग होते हैं। तो हमारा काफी समय जाता है गवर्नमेंट रेजोल्यूशंस को पढ़ने में, समझने में, अलग अलग स्कीम्स को समझने में, अकाउंटेबिलिटी स्ट्रक्चर्स को समझने में, और फिर लोगों को मेंटर करके वहां तक उनको रेफर करने में, और उसके बाद हम अपटेक ऑफ बेनिफिट्स देखते हैं, कैश ट्रांसफर्स देखते हैं। तो अभी हम देखेंगे पिछले 6 महीने का हमारा ये डेटा है, तो हम देखते हैं कि लगभग हर महीने हम 5000 लोगों तक पहुंचते हैं। ये हमारे अलग अलग प्रोग्राम्स हैं। इसके अलावा हम देखेंगे कि करीब करीब 35,000 लोगों को पिछले 6 महीने में इन सारी स्कीम्स की सुविधा मिली है। सबसे ज्यादा राशन और कोविड से जुड़े हुए जो स्पेशल राशन स्कीम्स थे उसकी सुविधा उनको मिल पाई है। इसके अलावा जो ऐसे लोग हैं जिन्होंने दूसरे और सोशल प्रोटेक्शन स्कीम्स का लाभ उठाया है, ऐसे करीब करीब 27,000 लोगों तक हम पहुंच पाए हैं जिन्होंने लाभ उठाया है इन स्कीम्स का। हमें किस तरह की सपोर्ट की जरूरत है सरकारी तंत्रों से, वो ये है कि मैटरनिटी रेफरल सिस्टम जहां पर बढ़िया चल रहा है उससे निकलकर हम इसको और बड़े पैमाने पर कैसे कर सके, स्ट्रीमलाइन कैसे कर सके। तो कुछ दिक्कतें यहाँ पर जो आती हैं, दिक्कतें ये आती है कि पूरा जो चैनल है उसमें कभी कभी कम्युनिकेशन गैप रहता है, ये हम सबको मालूम है। तीसरी बड़ी चीज ये है कि लोग, आम नागरिक कैसे फीडबैक दे सकते हैं, कैसे आमने सामने बैठकर सरकारी तंत्रों के साथ बातचीत कर सकते हैं ताकि वो सीधे सीधे अपनी बात लोगों को समझा सके, हायर ऑफिशियल्स को समझा सके। तो इस तरह की जो एक प्रक्रिया है, एक प्रणाली है, हम इसको और मजबूत करने की कोशिश कर रहे हैं। एक दिक्कत हमें बड़ी आती है जिस पर हमें काम करने की जरूरत है कि जो बजटरी एलोकेशंस है, वी नीड टू नाउ गेट इनटू अंडरस्टैंडिंग द बजटरी एलोकेशंस फॉर ईच स्कीम so that then we can actually monetize and see based on the uptake as to how much money has been used up by citizens who are eligible for such social protection schemes. Thank you very much. If there are questions, I'll be glad to take them.
Thanks, Emma, for sharing Sneha's experience in strengthening nutritional health access to social protection among the urban poor. Very specifically on, the lessons learned from the referral system and help desk. I think in the next presentation also we'll see some commonality. So if there are questions, I think we can take it up after Marina's presentation. Thank you once again. Over to you, Marina.
Yeah. Can you see my screen, Anuradha?
Yes, we can, but if you could put it on slideshow mode.
Right. Okay. All right.
Marina, please stick to time because we are running.
Definitely. तो जो ऑलरेडी बोला गया है मैं उसको रिपीट नहीं करती हूँ।
Yes.
युवा करके हम पिछले 10 महीने से एक सोशल प्रोटेक्शन फैसिलिटेशन सेंटर्स चला रहे हैं 3 अलग अलग जगह पे। तो खास करके इसका जो अनुभव रहा है और हम क्या सीख रहे हैं, अगर हम इसको एक स्टेट लेवल मॉडल फैसिलिटेशन करके देखना चाहते हैं आगे जाके, तो उसको लेके मैं कुछ चीजें शेयर करती हूँ। तो ये मॉडल एग्जैक्टली हम युवा करके बहुत सालों से हैबिटेट फैसिलिटेशन सेंटर्स, लेबर फैसिलिटेशन सेंटर्स और माइग्रेंट रिसोर्स सेंटर करके हम अलग अलग जगह पे, महाराष्ट्र में ही नहीं बट अलग अलग राज्यों में भी हम ये सेंटर्स चलाते हैं, जहाँ पे हम अलग आइडेंटिटी डॉक्यूमेंट्स, वजूद पत्र, सामाजिक सुरक्षा के डॉक्यूमेंट्स जो है उसका पूरा फैसिलिटेशन का प्रोसेस हमने चलाया है। तो बेस्ड ऑन दैट एक्सपीरियंस वी डेवलप द सोशल द SPFC model, where not only in one critique that often comes out from civil society organizations doing such work is that we limit this to individual needs, but through the center, how do you look at collectivizing around common concerns and then simultaneously do advocacy? That is actually something that we need to focus on while enabling access to social protection. Simultaneously, it's very important, like I think all the speakers before me had said, to have critical partnerships with various levels of governance, right from the village or slum level, right up to the district level, so that there is some ownership and sustainability, and this doesn't get seen ki हाँ ये तो NGO कर रहे हैं तो उनको करने दो, but how do you actually improve that system? The other thing is that the entire experience, I think this one very important aspect of facilitation that maybe has been discussed, but not in this lens, saying that when an individual enters any office, whether it is a bank, a post office, a talati office, a tehsil office, a block office, it is that experience ultimately. You go there saying कि मुझे संजय गांधी निराधार योजना के लिए application करना है. The response of that official saying, okay, but your Aadhaar is not linked to first, just that the response that the individual gets sometimes pushes them away from the system. But through a more care-based facilitation center, that attention, that support given through the process becomes extremely important. Simultaneously, and that's not to say that it takes away from the scaling approach, ensuring that social protection can be given through a responsive model is as important even while you go to scale. The other thing is this entire aspect of how do you work with evidence from the ground and then use that for advocacy. Through the SPFCs, we are looking at, this is something we are doing very closely with fields of YUVA and UNICEF. How do you develop a social protection scope? Whereby you can see vulnerable families do have additional vulnerabilities, whether due to flood, due to disaster, different kinds of disasters, climate disasters, etc. How does their score increase or decrease? And based on that, what are the social protection entitlements that they are able to access? Simultaneously, as many speakers before me have said, that बहुत सारे schemes में बहुत सारी दिक्कतें आती हैं. So what in some particular schemes, how do we develop policy briefs to actually address these challenges at a systemic level? So along with doing the day-to-day facilitation, these are some evidence-based work that we're also focusing on to ensure that the design and delivery of social protection is addressed through the entire model. Very quickly, so is my screen changing?
Yeah, changed now.
Okay, so just very quickly, we run these social protection facilitation centers in 3 diverse contexts: in an urban, peri-urban location of Panvel, in a rural area of, in Kagal, and in a tribal district in Chikaldhara. Overall, so we're looking at both an urban and rural outreach. Initially, when we started, we wanted to look at 3 particular themes, that was schemes for women and children, social protection for women and children, food-related schemes for workers, but then also look at how do you include pensions and housing, which are as crucial to ensuring the entire social protection flows are covered. But like again has been mentioned before, it's not, while you do facilitate just these schemes, accessing very basic documents are also important. So the centers also focus, and a lot of equal amount of time and energy goes into accessing these sort of documents, whether they're linked to Aadhaar concerns, domicile certificates, income certificates, medical certificates, etc., which also have their own procedures, and the Social Protection Facilitation Center ensures that this form of documentation also gets covered. Over the last 10 months, this is the outreach that we have seen, and the number of applications that are being sanctioned do have quite a high conversion ratio. So that is a positive, that with investment in human resource and investment at the ground level, we are able to see immediate results. Of course, there's a lot more that needs to be done, but results so far are quite positive. Very quickly, just to give an overview to that, and of course, I don't mean to say this is, some of it will appear as a repetition, but I won't repeat it. It's also on the slide, on the slides. While we say that the social protection, ultimately what CSOs are doing is to ensure access, but of course, awareness, determining eligibility, application facilitation, again at 2 levels, not just for social protection, but also for the base level documents, identity documents, is as crucial. So approval and access is really the last level that we look at. And of course, design, delivery, etc. That's more of a mandate of the state. But then of course, your advocacy also sort of feeds into that. So just quickly, if we go through at the level of awareness, a couple of challenges that we've seen are, one is of course the low levels of awareness of what the social protection schemes really are in tribal districts, like Amit mentioned, low literacy levels, geographically very challenging environments, whether that's poor connectivity, transport access, etc. So the having mobile social protection facilitation centers enable actual settlement level awareness meetings, camp sessions. There's also a lot of easy to access material on social protection schemes that the teams have developed. I will put that in the chat box. sharing those materials, also understanding what individual social protection needs are holistically. So if an individual does approach you at a meeting, at a village level, understanding the entire context, if the person in concern is a widow, understanding if they have children, what schemes the children are eligible for, seeing what schemes the family is eligible for, etc. So that entire giving that individual attention at the SPFC level becomes very crucial, also at the level of awareness. So it's just not just awareness and then moving away. Just a few pictures of how this awareness works at the ground level. The second strategy that we look at comes from the entire bit of eligibility. Because one is people are not aware of the identity documents, or if they have identity documents, whether they are up to date, how old they are, etc. Sometimes very challenging, when you're trying to apply for social protection. And of course, the gendered access of this is extremely obvious, that women are least likely to know whether they have certain documents, whether they're eligible for certain schemes, etc. The mobile phones, which has become very important today to access any of these schemes. A lot of women also don't have, smartphones, mobile phones, etc. But like I mentioned earlier, ensuring that hand-holding takes place. The other thing is this whole concept of stacking social protection schemes for individuals. If someone, like I mentioned earlier, if someone is coming to you with asking for a particular pension scheme, how is it that you understand all their vulnerabilities and then suggest maybe 4 or 5 or 6 social protection schemes that they are eligible for? Then the second level is the relevant identity documents, applying for that, ensuring that at the SPFC level you have tie-ups with CSCs, post office, banks, ward offices, etc. And of course, this is the stage at which you encounter the first level of challenge of not having enough documentation to access social protection. So then that brings us to the second bit, which is application at 2 levels, where you encounter agents, middlemen, political intervention, costs that are sometimes informal costs like bribery. Maybe it's just under the table. You can pay us this much, we'll ensure it gets done faster, of course. And then also the cost of travel from villages to block offices, very often that are very far from their place of stay. This is also a barrier if there are elderly people, disabled persons, those who are suffering from illness who need to get medical certificates done. And of course, this entire shift to online applications, which at one level is a welcome move, but it also keeps people further away from applying for actual social protection. So a few strategies that we use at the social protection facilitation center level is, one is ensuring that there are regular meetings with different line departments, so that they are aware of the work of the social protection facilitation center. They are able to be more responsive, appreciative, and also they are able to smoothen the entire process for people as well, if people are to go to these line departments individually and without maybe someone from the SPFC. There are also negotiations at various levels with political representatives if there are any blocks or any political gains that are sort of seen as because there's no doubt that social protection schemes are also politically charged, and before elections there is a push for certain schemes to be rolled out, etc. So doing those sort of negotiations and like I mentioned earlier, ensuring travel support, or just ensuring that the SPFC is mobile, that it's not just an office or one area with a few people located, but these people are able to go to different villages, go to different officials, do that entire process with them. And I think some of the speakers before me in their models have also shared how this is a very important aspect to ensure access to social protection. And lastly, of course, the stage of approval and access before delivery. Here, just challenges, of course, at the block level is that the applications need to be submitted there. The long process of approval, actually, even if the approval does come, and finding out when the social protection benefit will actually reach the person in concern. So following up with block district level officials if needed, following up on submissions, following up on disbursement of funds, and then making sure that the person who has come to you for the social protection also checks their bank account or checks, the different places that they need to go to access the social protection. So in terms of sustainability, one is the aim is to create a model social protection facilitation center that can be embedded within existing systems. And for that, there is it's been mentioned before, different levels of capacity buildings with whether it's ASHA workers, whether it is Anganwadi workers, young people's collectives, just so that they themselves are aware of different social protection schemes, benefits, etc. And at the village level or hamlet level or slum level, they are able to then do that application process themselves, and not to say that residents themselves, young people themselves, are then who are maybe more tech savvy, are able to do this sort of hand holding. Another thing that we're looking at is how do you develop village level social protection facilitation centers that act not just as facilitation, but also information centers, so that they can be a better link between the village, the Gram Panchayat, and the block level officials. Another thing that we have seen being successfully done in the Amravati district is a nodal officer being appointed to actually oversee all the applications from the Social Protection Facilitation Center, actually monitoring the entire provision of social protection and then feeding back into what needs to change both at the ground level and maybe what needs to change at the disbursement level. Similarly, very importantly, and I think through all the presentations, it's become very clear that at the state level, there is a need to coalesce around social protection demands, because these cannot be individual centers, individual organizations working to enable access to schemes. It needs to be a push for larger universal social protection, ensuring that design and delivery of social protection is done in a much more holistic way. And it's only by doing that that we actually achieve social protection for the most vulnerable and social protection that benefits the last mile. So that's it from me. Thank you very much.
Thank you, Marina. You also touched on the pathway that we are taking for institutionalization of some of these models. So we are late by 30 minutes in this segment. So I suggest we take questions after the next segment. That would be better. Just I would like to conclude and move to the next session. The discussions today helped us to understand the CSO engagement to complement government efforts for efficient implementation of social protection in a more, say, transparent and accountable manner. We heard diverse experiences, and what we heard today has been very rich experiences. And it gives us great potential for, in terms of improving access and coverage of social protection and getting it closer to the community. We also heard some enablers, successful conditions amongst these enablers. We understood I think from the starting, the conversation was about the role civil society can play in this space, and it's a very important role. But to be effective at a scale, we need to institutionalize this model with state support. In the last presentation, Marina sort of alluded to that in terms of necessitating our thinking for networking, collective action, and not a siloed institution. So I think our next segment will reflect on how these models can be institutionalized, and I will now hand it over to Roshni for to coordinate the discussion for institutionalization process. Thank you.
Thank you, Anuradha, and thank you all the speakers. I think बहुत ही विविध तरीके का perspective मिला हमें, right from tribal to urban to migrants to rural, and I think अलग-अलग private sector companies में कैसे भाग ले सकता है, unions and collectives कैसे ले सकते हैं, just really showcasing कि पूरे social protection facilitation के space में इतना काम हो रहा है अभी. And I think इसको हमें परखने की बहुत जरूरत है. But right now ultimately this is the social contract जो बोलता है कि this is a सरकार का जो एक पूरा एक responsibility है, तो उसके बारे में we will move on to the next session where institutionalization कि ये सारे facilitation के जो efforts है उसको कैसे हम embed कर सकते हैं within the state systems. तो उसके लिए we have three very important speakers. Abhay Pete ji, who is a retired professor from the Mumbai School of Economics and Public Policy, Raju Vise ji, who is from the Working People's Coalition and an urban activist, and Veena Bandyopadhyay, who is the social policy chief at UNICEF India. We are running a little late, So I request that we might have to go a little beyond one, if that's maybe 5-10 minutes. So request all of you to stay with us, because after these 3 speakers, we will want to open up the floor for discussion, and requesting all the speakers to speak for about 7 minutes, and starting with Abhay ji. So please, Abhay, if you can please start.
Okay, this has been a fascinating learning experience for me, and all the details and so on and so forth. What I intend to do in the 5 minutes that I will take is really, because I simply don't have the capacity to take in everything and unify it and come out with any very clear cut or whatever suggestion. But I will nevertheless make some suggestions. One is, we should step back from the particularities and details. And the good part about this whole thing, and I am keeping in mind the idea of consortium that is very much there in the background of all of this. And one good thing is that the geographies, the areas of work and so on that have been alluded to by different people here very lucidly and in detail, don't show any conflict. Because anyway, people will join into any coalition or consortium if they can get something out of it better than if they were to work alone. Now, the usual things like, not reinventing the wheel, etc., etc. From that point of view, I think if you look at what was said, I'm looking at it, I would say documents, documentations, dialogue, and interface. Yes, these were 3 words that came to my mind from everybody talking. Then what came to my mind was the usual stuff that I always talk about, which is the overall governance framework, which is policy framework, then processes, then capacity, implementation, and IEOs. If you put these things together, you will find that there is some comparative advantage to be had by looking at each one of them. And maybe that is where the exchanges can happen. For example, even where the IT is not possible in the harder markets, so to say, Amit was able to show how it was difficult, but how he managed to do it through actual ground level kind of committees and so on, and bring about stuff. Now, that is a learning that others can have, and he can bring, and there are many other things, but I'm just pointing out to one of the things that immediately struck me. Now, as far as the Ashwini was concerned, I think it's very important that for consortium kind of work, when we step back, the kind of work that she has been involved with is very important. Because many of the other people did say that they are not interested, or not that they are not interested, but they are not doing things like evaluation of policy, etc. Whereas Ashwini has done that kind of stuff for a particular scheme nevertheless. But she knows how to do documentation through her networking and so on. And that is what she brings to the table of how to, our job is to abstract from her particularities and then come back to seeing how we can see the entire list of vulnerabilities that we are wanting to look at, and then provide for documentation in terms of research studies, not in terms of the capacity and implementation of the necessary documents, etc. I don't mean that way. Also, what she talked about was very important, was to do with creation of a space or a formal space where one could all bring together these different experiences and practices, which could then themselves, it becomes like a library, and people who are working, the NGOs who are working around it, can refer to this and say, hey, this is an area within the framework that we have, which incidentally, I like the YUVA framework a lot as a comprehensive framework. And of course, their agencies that they are trying to put in. And so research, guidelines and policy tweaks, and reflections which individual NGOs typically don't like to do. Perhaps they don't have the bandwidth. That is not their job. They want to do good. But a consortium can afford to have that bandwidth. So that is where they can look at. Also, creation of all the documents along with the listing, the framework for which has been provided both by Rama as well as the last, the UA person and Marina. And those frameworks can be put together and generalized, and we could make use of these things. Now, particularly at the last mile problem, I was very impressed by Darsha and the solution, and they were absolutely clear. And as an economist, it was very good to hear that there is a revenue model that is there, which makes it viable and not just completely dependent on the goodness of the hearts of people and stuff like that. So the IT leveraging, the facilitation, the capacity, and so on that we have, not directly to the people, but to the NGOs themselves in their domains, would be a very important thing. So there is something for each one to take from the others. And of course, if everyone gains from this, I personally think we need to sit back and reflect and create some paper which abstracts, steps back and charts out a plan for how do you go ahead with the consortium. And of course, the last thing Vince has talked about was the dialogue, because some people seem to have a greater leeway with how do you talk with the government agencies, etc., etc. So maybe the others can take help of these people and interact with the government agencies which are identified in a particular conceptual framework. Finally, as a consortium, it would be possible to do the evaluation work. Because Amit mentioned that, when they did evaluation, and that has been my experience, very limited that it may be, government departments particularly don't particularly like critical evaluations for various reasons. But done by individual kind of NGOs. But if it is a consortium, then it can also take up the job of being an IEO and can talk and have a greater weight. I will stop here. Yeah, thank you.
Thank you so much, Abhay. I think you both spoke about the content of how to move forward as well as the structures and the processes. I think दोनों की जरूरत होगी आगे जाके as a consortium जब हम काम करेंगे. So thank you for that input. मैं राजू को invite करूंगी. राजू, अगर आप हो, आप थोड़ा अपनी बात रख सकते हैं.
जितने भी प्रेजेंटेशंस आए और अभय जी ने जो बात रखी, मैं उससे थोड़ा आगे बढ़ाता हूँ कि एक्चुअली सभी प्रेजेंटेशन को अगर हम सुने या और सोशल प्रोटेक्शन के जो रूट है वो रूट को अगर हम समझते हैं तो फिर बेसिकली पॉलिसी फ्रेमवर्क जो है, पॉलिसी फ्रेमवर्क और अलग अलग जो पर्सपेक्टिव्स है वो काफ़ी इम्पोर्टेंस है, क्योंकि ILO का एक फ्रेमवर्क है, यूनिसेफ का एक फ्रेमवर्क है और फिर उसमें काम करने वाले जो भी इंटरेस्ट ग्रुप है उनका एक पर्सपेक्टिव है. तो ये मुझे लगता है कि काफ़ी इम्पोर्टेंस है. कन्वर्जन होना है तो फिर इसमें भी किस तरह से कन्वर्जेंस हो सकता है उसके बारे में हमको सोचना पड़ेगा. पॉलिसी फ्रेमवर्क में जब हम समझ रहे हैं तो तीन चीज़ें सामने आ रही है. एक चीज़ है कि जो अभी के जो सोशल प्रोटेक्शन के जो स्कीम है वो यूनिवर्सल नहीं, टारगेट ओरिएंटेड है. तो उसको एज अ राइट फ्रेमवर्क में हम कैसे देख सकते हैं और उसको कैसे इंश्योर कर सकते हैं, तो उसके लिए भी एक पॉलिसी फ्रेमवर्क में पॉलिसी के स्तर पर काम करने की ज़रूरत है. दूसरा एक जो चैलेंज जो सामने आ रहा है बेसिकली, खासकर प्राइवेट सेक्टर्स को इन्वॉल्व करना और उसको कमर्शलाइज करना, खासकर हेल्थ के कॉन्टेक्स्ट में. जितने भी हेल्थ इंश्योरेंस की जो स्कीमें हैं सोशल प्रोटेक्शन में, तो वो बेसिकली एक राइट्स न होते हुए बेसिकली एक कंज्यूमरिज्म की फ्रेम में उसको ढकेलने का जो बेसिकली जो काम दिख रहा है, जो अप्रोच दिख रहा है, उसके बारे में सिविल सोसाइटी ग्रुप में भी एक मत नहीं है। उसके बारे में भी हमको बेसिकली पॉलिसी फ्रेमवर्क में जब एडवोकेसी करके काम करेंगे तो क्या अप्रोच से हम आगे बढ़ेंगे, वो बहुत इम्पोर्टेंट चीज है। तीसरा जो है कि जो भी सर्विसेज है उसका जो फैसिलिटेशन जो है, तो उसमें प्रोसेस और प्रोसीजर में एक डोर कीपिंग जो हो रही है, तो उसको कैसे रोका जाए। मतलब किसे मिलेगा, किसको नहीं मिलेगा, जो डॉक्यूमेंट्स है वो डॉक्यूमेंट्स के डॉक्यूमेंट्स भी किसे मिलेंगे और किसको नहीं मिलेंगे। ये जो एक डोर कीपिंग वाला जो एलिमेंट्स है, वो फैसिलिटेशन में बहुत इम्पोर्टेंस है। तो उसको कैसे हम हैंडल कर सकते, क्योंकि अगर हम एक मॉड्यूल की बात कर रहे हैं कि फैसिलिटेशन सेंटर्स जो है, मॉड्यूल जो है, उसको कैसे इंस्टीट्यूशनलाइज करना है, तो ये चीज़ों को भी हमको ध्यान में रखना पड़ेगा। और एक महत्व का मुद्दा है कि गवर्नेंस को समझना है कि अगर इसे इंस्टीट्यूशनलाइज करना है तो गवर्नेंस का जो फ्रेम है वो क्या है। तो बेसिकली इसके लिए भी अलग अलग डिपार्टमेंट्स है पॉलिसी बनाने के लिए। बेसिकली विमेंस एंड चाइल्ड डिपार्टमेंट्स है, लेबर डिपार्टमेंट है, लेकिन दो डिपार्टमेंट स्टेट के स्तर पर बहुत ही इम्पोर्टेंस है, जो है प्लानिंग और दूसरा फाइनेंस। तो प्लानिंग और फाइनेंस डिपार्टमेंट जो है वो, क्योंकि पॉलिसी फ्रेम तो हो जाता है, बस एग्जीक्यूशन जो करना है या उसको पुशअप करना है, तो ये दोनों डिपार्टमेंट का रोल बहुत इम्पोर्टेंस है। तो एडवोकेसी ये मॉडल को हमको इंस्टीट्यूशनलाइज करना है, तो भी हमें अलग अलग डिपार्टमेंट के साथ और प्लानिंग डिपार्टमेंट्स और फाइनेंस डिपार्टमेंट के साथ एडवोकेसी हमें करने की ज़रूरत पड़ने वाली है। तो ये भी मुझे लग रहा है। तीसरा जो है कि इसका ये मॉड्यूल को अगर फैसिलिटेट करना है तो गवर्नेंस के फ्रेम में बेसिकली लोकल बॉडीज जो है उनका बहुत ही महत्वपूर्ण रोल हो सकता है। वो इसलिए हो सकता है क्योंकि कोई भी मॉड्यूल में इजी एक्सेस कहाँ हो सकता है, वो अगर हम देखें तो वो फिर लोकल बॉडीज के जो भी सेंटर्स है वो सेंटर्स में हो सकता है। जैसे रूरल में देखेंगे तो ग्राम पंचायत के इजी एक्सेस का जगह है, जो आम लोग जो है उसको वहाँ जा सकते हैं। शहरों में अगर हम देखते हैं तो शहर का जो गवर्नेंस है वो काफी कॉम्प्लेक्स है, लेकिन जो अभी के स्थिति में प्रभाग समिति जो है, जो वार्ड कमेटी जो है, तो वहाँ पे एक्सेस हो सकता है। जो वार्ड ऑफिस है वो वार्ड ऑफिस एक्सेस हो सकता है लोगों को, लेकिन जो नगर राज बिल का जो पूरा नगर राज बिल के माध्यम से जो मोहल्ला सभा और मोहल्ला समिति का जो प्रोविजन किया गया, कुछ राज्यों में वो अमेंडमेंट हुआ है, कुछ राज्यों में अभी तक अमेंडमेंट नहीं हुआ है। वो मोहल्ला समिति का रोल भी ये इस तरह का फैसिलिटेशन जो है वो लीगल फ्रेमवर्क में है। और जिन जिन राज्यों में ये मोहल्ला समिति का अर्बन गवर्नेंस में कानून पास हुआ है, वहाँ वहाँ इस तरह के फैसिलिटेशन कर सकते हैं। लेकिन महाराष्ट्र में ये प्रभाग समिति और वार्ड समिति तक स्पेस है, वो स्पेस को कैसे हम यूटिलाइज कर सकते हैं वो देखना चाहिए। दूसरा मुझे लगता है कि जब ये इंस्टीट्यूशनलाइज करने का जो मुद्दा है उसके साथ मैंडेट, लोकल बॉडी का ये मैंडेट है कि नहीं, तो लोकल बॉडी का ये मैंडेट है, क्योंकि सभी लोकल बॉडीज का गरीबी निर्मूलन और वंचित समूहों का सक्षमीकरण करना और उसके लिए योजनाओं का अमल करना, ये बेसिकली मैंडेट सभी म्युनिसिपल कॉरपोरेशंस और जो रूरल लोकल बॉडीज है, ग्राम पंचायत जो है, वो एक महत्वपूर्ण सेंटर माना है और उनका काम करके उसको माना गया है। लेकिन प्रॉब्लम ये है कि उनके पास इंफ्रास्ट्रक्चर नहीं है, रिसोर्सेस नहीं है और प्रैक्टिस नहीं है। तो ये मॉड्यूल को अगर इंस्टीट्यूशनलाइज करना है तो वो सही जगह ग्राम पंचायत है, प्रभाग समिति या वार्ड जो वार्ड का जो ऑफिस है वो है, और वहाँ लेकिन इंफ्रास्ट्रक्चर और प्रैक्टिसेस कैसे विकसित कर सकते हैं वो हमको सोचना पड़ेगा और उसके लिए एडवोकेसी करनी पड़ेगी। और दूसरा जो और एक इंडिकेटर्स है कि जन भागीदारी का स्कोप कहाँ पे। तो ग्राम पंचायत के स्तर पर जन भागीदारी का स्कोप है, क्योंकि वहाँ ग्राम सभा है, ग्राम सभा के माध्यम से मॉनिटरिंग हो सकता है, और जो सिविल सोसाइटी ग्रुप है वो भी उसमें पार्टिसिपेट हो सकते हैं। शहरों में वो एक चैलेंजिंग मुद्दा है, क्योंकि प्रभाग समिति में सीबीओ एनजीओ फोरम जैसे कुछ चीजों को हमें प्रमोट और फैसिलिटेट करना पड़ेगा, जिसके माध्यम से एक जन भागीदारी प्रभाग समिति के काम में बढ़ाई जा सकती है। वो स्कोप है, लेकिन उस तरह के मूवमेंट जो है वो शहरों में देखने को नहीं मिलते हैं। बट जहाँ जहाँ क्षेत्र सभा का प्रोविजन है, जिन राज्यों में है, वहाँ पे डायरेक्ट आखिरी व्यक्ति भी वो मोहल्ला समिति के काम में पार्टिसिपेट कर सकता है, तो वो स्कोप है। सबसे बड़ा जो चैलेंज है, मुझे लगता है जिसके ऊपर हमको काम करना चाहिए, पब्लिक, गवर्नमेंट ऑर्गेनाइजेशंस और सिविल सोसाइटी के जो ग्रुप्स है वो मिलकर ये मॉडल को कैसे डेवलप कर सकते हैं और इंस्टीट्यूशनलाइज कर सकते हैं, वो हमें देखना चाहिए, इंश्योर करना चाहिए। मैं यहाँ रुक रहा हूँ। थैंक यू।
थैंक यू राजू। आपने आई थिंक लोकल गवर्नमेंट का एक जो बहुत इम्पोर्टेंट महत्व दिया ये पूरे प्रक्रिया को इंस्टीट्यूशनलाइज करने के लिए, एंड अलग अलग मिनिस्ट्रीज एंड डिपार्टमेंट। सो इट इज अ कॉम्प्लेक्स प्रोसेस फॉर श्योर, बट आई थिंक हमें हर स्तर पे काम करना है। थैंक्स। आई विल रिक्वेस्ट वीना फ्रॉम यूनिसेफ दिल्ली टू प्लीज कम एंड शेयर हर थॉट्स एज वेल। And किसी को questions है तो please do keep putting it in the chat, and after Veena we will open up for a small discussion.
So colleagues, good afternoon. Thank you. One small correction, Roshni, I'm social protection specialist in India country office, and our chief is YUVA. So that's a small correction, but thank you for inviting this, and thanks so much. First of all, congratulations to Anuradha and entire each and every member of consortium for organizing this, because more than you all, we had a lot of opportunity to learn, and it's really coming up very, very best way and moving in right direction. So it was very overwhelming learning, and it will take a while for me to digest the whole thing and what it has offered. So a couple of, I think Abhay and other colleague, the two speakers before me have already covered everything. I don't need to, the Abhay ji has covered the entire system process and so system and policies and processes that are very critical, and within that the we need to bring out evidence. So one thing which and then the second speaker who has talked about various dimensions of social protection, including the conceptual clarity to definitional thing, and then structures and financing and governance. So it's a whole lot of spectrum. So if you only look at the two prior speaker, it shows the complexity and of the entire system of social protection, and it is not easy unless we come together. So I have one addition to make in others to two, and then also summarize. So before I make addition, I would just like to summarize, perhaps in my view. So one thing is that I would echo the point that has been made by the first speaker in terms of the start studying or evaluating some of the great initiative that this consortium members have presented in terms of at two levels. One is, I think there are good examples in many presentations where the elements of success are very clear, and those successes with those elements can be design element, can be monitoring and evaluation element, can be communication and awareness generation element. So I think those elements need to be documented in terms of how they have led to the coverage of the last mile, how they have expanded the connectivity issue and target improving the target. What it will do is to, as a knowledge product, it might contribute to the larger policy insight. So that's my first thing in terms of element. Second thing, all the presenters, what they have very beautifully done, and almost everyone, whatever they have done, whether it is a social protection facilitation center, where they have Mardarshak, where the app issue has been talked, whereas in REGS consortium, the colleague who talked, including that entire how they have been able to influence guideline and everything. So I will say that there has already been, this group has made progressive effort in terms of already a step towards formalization. When we say institutionalization, we have to be very clear what do we mean. And what we mean is that all our learning from the grassroots work and research work and evidence should inform policies, policy retweaks, policy adjustment, policy priorities. Other thing is that the systems that are there, so systems are also very complex. So increasingly we feel that social protection system which runs across the department, and every department has one little scheme and one little system of enrollment and registry, perhaps we need to advocate more integrated and comprehensive approach. And then so that, and in terms of processes, there is whole lot of processes, as you all have said, in processes in terms of procedural compliance, processes in terms of department which are same target group have multiple schemes and reach out in different own way, processes in terms of communication strategies. These are the processes sometimes overlapping and very, very complex, and they need to be streamlined. Now, so all this has to be developed in the form of matrix in terms of policy system processes that has to be advocated at national level and also within a state. Other one is that entire the delivery structure, which second speaker before me has talked, and he has succinctly touched on all the issues, is starting from the conceptual clarities to definitional issue to financing and sustainability to governance structure, including at decentralized level, Gram Panchayat and GPs. The third thing which I was wanting to bring attention of the consortium is that all these schemes that we are talking and being UNICEF as an organization, so children's issue and child protection has traditionally not been a mainstream issue. Social protection itself started as a kind of support to household and adults, and it was assumed that the children's issues and girls issues and boys issue will be once household is supported will be addressed. But COVID has highlighted the learning loss and many other vulnerabilities which are so different than adult vulnerability. So the all this existing work by the collective and members of this collective might be required to relook in terms of shock perspective, how it has made each scheme during COVID-19. What are the efforts that have made the schemes a little bit more shock resilience? For example, in REGS with the top-up happened. For example, PDS where additional rations were provided. For example, there were many other new schemes were launched like our COVID affected, our funds. So, so one is the entire shock and humanitarian lens that must be brought into. Second, I think the equity lens in terms of gender transformative that we in UNICEF talk a lot. So whether the schemes are impacting in the same way or impacting, there is gender lens that is required, perhaps a good way to also approach and advocate about this scheme. And child, I have already mentioned, the child at the center is, because if we want to reduce poverty, the intergenerational approach of breaking of poverty cycles will be very, very critical. So these are the last one. I thought it's additional perspective that I brought, but I echo all the point that has been made by the other two speakers prior to me. And congratulations to each and every member of, I'm really extremely thrilled, and thanks to you and Anu and the entire member. I think we will also like to bring the consortium and we will discuss it. Can we have this consortium presentation to Niti Aayog? So this is also a way to make the government hear what all. And last of all, I want to say that what was the beautiful thing in this consortium is that we focused a lot on how to improve access and entitlement. Because design and other thing is long-term processes, and that will take more evidence and more advocacy and other thing. So there are groups that are working, a lot of evidences and generated and design, but this very critical aspect of expanding coverage to the last mile, and this entire deliberation has been extremely, extremely insightful. So thank you. I really learned a lot, and we should join each other, and if Anu agrees and you also agree, maybe the next presentation we can schedule something with Niti Aayog Ayog and this consortium can bring a lot more this thing to Niti. And let's have not more than 3 presentation in half-day session, allowing more time to even consortium colleagues to also interact. Thank you so much, and thanks for the opportunity to you and Anu both.
Thank you so much, Veena, for your kind words. And I think definitely hum dekhenge ki how can we link the state processes to the national level as well. Thank you for your time. We are at 1. हम 1 को officially end करने वाले थे, but I do think that हम अगर सभी की राजी है तो हम थोड़ा टाइम ले सकते हैं डिस्कशन क्वेश्चंस के लिए. तो स्पीकर अभी भी है हमारे साथ and they have kindly consented कि कुछ टाइम तक रहेंगे. And हमारे दूसरे पैनलिस्ट भी है. So anybody please feel free to either raise your hand, unmute yourselves and ask any questions. या अगर आप chat में डालना चाहते हो, if there's anybody.
I have one question for Haq Darshak, but I think the colleague is not
I think वो
here.
चले गए. She had to leave at noon.
So maybe I can share the question
Sure.
later
हम
on.
उनको communicate कर सकते हैं. Yeah. किसी के है questions? भास्कर?
क्वेश्चन आई हैव पुट इट ऑन चैट, लेकिन क्वेश्चन भी नहीं बोल सकते, एक सजेशन हो सकता है. जो अर्बन का जो राजू सर ने जो मुद्दा रखा, मैंने लिखा है वहाँ पे कि जो साहस था साक्षरता अभियान, आई वॉज वर्किंग विथ दिस एट दैट टाइम, एंड द साक्षरता अभियान इन्वॉल्व्ड all the agencies, NGOs, GOs and all the officers, and they have a nodal officer, that the ward officer is the main in charge, but they have appointed AO schools, that they assist associate program officer or somebody that from the education department, and he is the responsible to lead the campaign, and it's quite successful and very responsible, though it's not be 100% successfully. It was 100% literacy program, but it quite responsibility taken by the department. In the same way, if we think and have the responsibility to such a government official to link all these schemes through in the urban, we can have a thoughts on this.
Definitely, I think इसका सब documentation करते वक्त I think ये साक्षरता अभियान वाला case study भी थोड़ा हमें study करना important होगा. उसकी क्या learnings रहे, कुछ challenges थे, etc. So thank you भास्कर जी. किसी और को कुछ मुद्दा उठाना है?
Can I?
Yes, please, Jalinder.
This is Jalinder Adsule. In fact, I was very happy that I could attend this webinar. All speakers and their presentations and views expressed were excellent. Only my hunch is that whatever models was presented, they are doing wonderful work in their own area. My question is that how we can somehow support the groups which are working isolatedly in the different areas. Is there a way or maybe some sort of strategies which we can develop to strengthen those groups also? Because what group I heard are quite established, doing wonderful work. But I think looking at the vastness of our country and complications of our problem, I feel that that is not enough. We have to reach more and more people with different strategies and with different resources. So is there any way by which we can even network with other groups, or can we make some sort of appeal to these isolated groups who can contact you? Just for example, we have been working in Dhule district, again dominated by tribals and Dalits, but somehow maybe because of not contact or maybe because of number of other limitations, we were not able to generate funding or maybe resources. And that's the reason since last 4-5 years, even during this COVID also, we have been collecting certain monies and trying to distribute. Like it was like a maid-based support to these people. But listening to other people, I think other people are doing quite good things. So like I heard about, the different things. So is it somehow what you call the way by which we can even the share resources, at least some websites or maybe material or maybe where, whatever different apps we can develop, so by which we can also bring those groups also up to certain level by which this can be strengthened. So we can identify certain groups which are working in different areas who are willing, so we can support them. I think that was just a observation.
Jalinder ji, I think very critical observation. Anybody जो core group consortium से है, Amit, Ashwini, Abhay, any of you want to respond to this in terms of आप लोग भी very remote areas में काम करते हैं? I mean, I think point is very well taken. किसी को respond करना है तो the floor is open. I don't know, Amit and Ashwini, are they here?
No, it's not necessary now only, but we can share it. My name, I have already.
We got the point. We will.
Yeah, my contact and I think email also is there when I register myself. So we can share certain information and certain resources.
Thank you, Jalinder ji. Jayesh ji, you want to say something? आप कुछ बोल रहे हैं जयेश जी? मे बी नॉट. और किसी को कुछ कमेंट्स या इनपुट देना है या स्पेसिफिक क्वेश्चन पूछना है? हाँ जयेश, आप बात कर सकते हैं. आपका हाथ मैं देख रही हूँ, आप अनम्यूट भी हो. अगर आपका साउंड नहीं चल रहा तो मे बी आप चैट में लिख सकते हैं. मे बी ओके. We'll wait on Jayesh ji. Anybody else wants to say anything or ask anything?
May I come? Okay.
Yes, please. Go ahead.
So one query I had, that there was one presenter who mentioned about one ration, one card. So any one of the members can share some update? What is the status of that and which direction there is a movement? I have no idea about.
Either the presenters or anybody from the audience whose experiences want to talk about it?
Can I say?
Bhaskar ji, just hold on. We are answering Veena's question, then we can come back to you.
Veena had actually answered this in the chat, just based on our experience in Maharashtra. We have seen that one is that intra-state access is much higher. And the other thing is, again, facilitation centers do play a big role in ensuring that happens, because that negotiation actually is with the fair price shop owner. It's not been streamlined to such an extent that you can just take your ration card from any state and say, I should be eligible here. And a lot of that is another challenge encountered is this entire seeding, Aadhaar seeding issue. If your card has not been seeded, then also you're not able to access the rations under the One Nation, One Ration scheme.
Yeah, so, just to add, with all the states, the process has not been streamlined. With some states, it's possible for the residents of that states to access the schemes, but with some other state, it's not there. So it's not uniform across the states.
Uniformity का बहुत बड़ा issue.
Yeah, एक चीज और highlight करना था वीना जी, कि हमने ये हमारी presentation में भी कहा था. This whole aspect of determining below poverty line families with just 59,000 income per year per family is becoming, I mean, it's actually, if you look at it, is the root. I don't know if at a consortium level, we would be interested in advocating for increasing the income levels, because it is really a no-brainer. It does not tell us or give us any real picture about poverty across the country.
No, that's very important point. I think ये जो eligibility के criteria है, उसमें ही बहुत बदलाव की I think जरूरत है.
Roshni, I have a small point. Roshni, I'm Prabha here.
Please.
First of all, congratulations, and the consultation is really it's giving lots of insights. When here on this platform, we are educationists, activists, social workers, and researchers and all that. And I was thinking, in our next consultation, if we can involve people, those who come from the Panchayat Raj representatives. From urban, it could be some Nagar Sevaks. From rural, it could be some Gram Sevaks or Sarpanchas. ideas and reality and wisdom from grassroots. So governance, when we are talking about governance, we may get some ideas at this present moment, how the entire thing is getting function and what kind of greater ideas can be shared by them. So considering 1993 Panchayat Raj Act, I think in what way we can consider participation of this grassroots in our consultation. That is what my suggestion and question also. Thank you.
No, thank you, Prabhaji. I think Raju also mentioned very strongly the involvement of local governments in actually unlocking these schemes. So definitely वैसे conversations की बहुत ज़रूरत है, and वो I think बहुत सारे संस्थाएं civil society groups local level पे कर रहे हैं, but उसको कैसे state level पे with RDPR, with urban development, I think उनके साथ कैसे करना, I think that's very important. But also आपका point एक important agenda बनता है आगे consortium के जो काम के लिए भी कि लोकल गवर्नमेंट्स, एंड अभी साइड बाय साइड वो एसडीजी लोकलाइजेशन की भी बात चल रही है, तो उसी वेव पे हम कैसे लेवरेज करके सारे सोशल प्रोटेक्शन का भी कैसे कर सकते हैं, आई थिंक दैट्स वेरी इंपॉर्टेंट. थैंक यू सो मच. Maybe one more question and then we can wind up. People also needing to leave, so I just want a minute to wrap up the discussion. But और किसी का है question? Okay.
मुझे बोलना था.
हाँ बोलिए.
मुझे ये बोलना, मैंने वो सवाल डाला था लेकिन उसके ऊपर बात नहीं हुई. जो ट्राइबल्स में जब भी बीच में बहुत बारिश हुआ था तो हम लोग शाहपुर में गए थे. आज भी वहाँ पे एक औरत को काम पे जाने के लिए इतना एडिक्शन है, काम पे जाने के लिए अपने को दरवाजे के अंदर बंद करके रखना पड़ता है, बांध के रख के. एक औरत तो बांध के रख रही थी और वो बता रही थी कि क्यों ऐसा कर रहे हैं. तो शेयर कर रही थी कि वो काम पे ही नहीं जाना है, तू घर पे ही रहो, तो पैसा नहीं आएगा तो खाना कहाँ से. और शाम को बोलता है कि खाना दो या दारू के लिए 5 रुपए 10 रुपए दे दो. और दूसरा है कि वहाँ पे हमने देखा कि जो गाय और भैंस बांधने का रखने का जो जगह होता है तबेला छोटा सा, वहाँ पे तो इतना बड़ा है ही नहीं, ये क्या 2 गाय हमने देखे. तो वहाँ पे जो सीनियर सिटीजन है उनके साथ सोए हैं. और क्यों वहाँ पे जाके बात की, तो क्यों कि जो उनके जो यंग जनरेशन जो है काम के लिए बाहर निकल गए, दूसरे गांव गए. तो क्या सिचुएशन है. तो ये मुद्दे भी ऐसे जो हम लोग जब भी जाते हैं गाँवों के साथ काम करते हैं, तो ऐसे चीजों के ओर हमें ध्यान रखने की जरूरत है और ये कंसिडर करने की. क्या सिचुएशन होगा, वो बुजुर्ग माँ औरत है या जो बुजुर्ग आदमी है, तो उनकी क्या सिचुएशन होगी, उनके खाने का क्या है. और वहाँ के जो पंचायत के सदस्य थे उनको बोला कि हमें थोड़ा गाँव में घूमना, ये करना है. उन्होंने सब सारे लोगों को जो हम लोग कुछ चीजें लेके गए थे, बात लाइन पूरा लगा था, लेकिन गांव में जाने को नहीं दे रहे थे.
नो, आई थिंक आप जो इशू रेज कर रहे हो वो सिर्फ गांव की नहीं, अर्बन एरियाज में ये जो लास्ट माइल बोला जाता है, लीव नो वन बिहाइंड, डेफिनेटली उसमें सीनियर सिटीजन्स है, उसमें बच्चे हैं, उसमें एकल महिलाएं हैं. तो आई थिंक एक अच्छा पॉइंट है मे बी टू स्टार्ट क्लोजिंग आज का पूरा डिस्कशन, कि आज के जो एक्चुअल फैसिलिटेशन का जो फोकस था, एनेबलिंग वो फैसिलिटेशन, जो अलग अलग मॉडल्स की हमने बात सुनी, आई थिंक सब में ये क्लियरली बहुत उभर के आ रहा कि वन साइज डज नॉट फिट ऑल, बिकॉज हमारे यहाँ इतना डिवर्सिटी है. एंड अगर सच में हम लास्ट माइल, लीव नो वन बिहाइंड को सिर्फ एक ऑप्टिक्स वाला स्टेटमेंट न बताते हुए, इफ वी रियली वांट टू मेक दैट हैपन, देन वी हैव टू कंटेक्चुअलाइज. हमें वो हैंड होल्डिंग हो, हमें वो लोकल लेवल पे किस तरीके का न्यूएंसिंग लाना है, उसकी बहुत जरूरत होती है. आई थिंक दैट इज वेरी क्लियर. तो आई थिंक कंसोर्शियम के लिए भी, जैसे अभय ने भी बोला कि इस तरीके के पूरे प्रैक्टिसेस को डिस्टिल करके उनको कैसे हम एक पॉलिसी डॉक्यूमेंट या पॉलिसी ब्रीफ में लेके आए, आई थिंक दैट इज रियली वेरी क्रिटिकल टू टॉक नॉट जस्ट अबाउट एक्सेस, बट एक्सेस इन अ वेरी न्यूएंस्ड एंड कॉन्टेक्चुअल वे. आई थिंक ये बहुत एक इम्पोर्टेंट पॉइंट आया. एंड दूसरा, moving from targeted to universal, of course this is our larger mandate and ये low hanging fruit नहीं है, but I think वो हमारा horizon उधर तक जाना चाहिए, तब भी हमारे आजकल के strategies भी उस दिशा में जाते रहेंगे. And मुझे ये भी लगता है कि there are challenges, अलग अलग departments हैं local स्तर से state स्तर पे, and ये पूरे privatization भी साथ में आ रहा है, जहाँ citizens को clients के मोड में देखा जा रहा है. I think these are all realities. एंड हमें इन रियलिटीज को मद्देनजर रखते हुए हमारे जो भी पॉलिसी के इनपुट्स है एंड प्रैक्टिस के जो इनपुट्स है, वी हैव टू कीप शार्पनिंग दैट. आई मीन आई थिंक हम बहुत ही साइलोड अप्रोच में या तरीके से अगर देखेंगे तो वी विल नॉट अप्रिशिएट जो सोशल पॉलिटिकल शिफ्ट्स भी हो रहे हैं इन टर्म्स ऑफ सोशल वेलफेयर, इन टर्म्स ऑफ सोशल पॉलिसी। एंड आई थिंक इसके लिए इस तरीके का एक जो डाइवर्स ग्रुप है, जहाँ एकेडमिक्स भी है, मूवमेंट्स भी है, ग्राउंड लेवल के एनजीओज भी है, आई थिंक उसका यही एक हमारा एक गोल था कि ये सारे प्रक्रियाएं, आई मीन पर्सपेक्टिव्स फ्रॉम माइक्रो टू मैक्रो, हम उसको ध्यान देते हुए आगे बढ़े। एंड डेफिनेटली प्रोसेस के हिसाब से ये जो आज पूरे डिस्कशन हुआ, प्लस कुछ लोगों ने और भी एग्जांपल्स दिए, उसको हम थोड़ा एनालाइज करके डिस्टिल करके एक पॉलिसी डॉक्यूमेंट के स्वरूप में लेके आएंगे, जो सबके साथ ऑफ कोर्स शेयरिंग किया जाएगा। सो नॉट जस्ट अ कंसल्टेशन रिपोर्ट, बट एक्चुअली एक चीज जो हम जाके प्लानिंग डिपार्टमेंट से हो, RDPR से हो, वी कैन WCD, वी कैन एक्चुअली गो एंड सबमिट। वो डेफिनेटली एक आगे का स्टेप रहेगा। दूसरा जो कंसोर्शियम के क्रिएट करने का यही मेन मकसद था कि एक क्रॉस डायलॉग क्रिएट करना, नॉट जस्ट की सिविल सोसाइटी के साथ, बट एक्चुअली GOs, गवर्नमेंट एजेंसीज के साथ भी। आई थिंक दैट इज अ वेरी क्रिटिकल स्पेस एंड दैट इज द मोस्ट इंपॉर्टेंट स्पेस एंड मोस्ट डिफिकल्ट स्पेस एज वेल। अगर हम सरकारी अफसरों को बुलाते भी है मीटिंग्स में, कंसल्टेशन में, ऑफ कोर्स उनका उतना टाइम भी नहीं देते हैं। सो बट आई थिंक अगर कंसोर्शियम करके हम एक प्रेशर ग्रुप क्रिएट कर सकते तो सुनने पे भी मजबूर किया जा सकता है। एंड आई थिंक वो कंसोर्शियम जितना डाइवर्स हो उतना ही उसका जो इन्फ्लुएंस है वो भी डीप हो सकता है। एंड हमारी ये डेफिनेटली कोशिश रहेगी कि हम आउटरीच बढ़ाए। वी आर वेरी हैप्पी कि over 100 different groups joined us today, different people joined us today, but I'm sure कि बहुत सारे लोग मिसिंग भी है इसमें से from different parts। महाराष्ट्र बहुत कॉम्प्लेक्स स्टेट है, तो कंसोर्शियम की ये भी कोशिश रहेगी कि वी कंटिन्यू आउटरीच। एंड आप भी प्लीज हमारे साथ, आप सब हो इस ग्रुप का, तो प्लीज कंटिन्यू टू कीप अस इन्फॉर्म्ड। अलग अलग इनिशिएटिव्स कहाँ हो रहे हैं, उनके साथ हम कैसे रीच आउट करके शेयरिंग, सॉलिडारिटी बढ़ा सकते हैं। सो डेफिनेटली आई थिंक ये 3 इमीडिएट स्टेप्स हम देख रहे हैं, डिस्टिलिंग ये जो लर्निंग्स है, प्लस वो स्पेस एंड इन्फ्लुएंस ग्रुप क्रिएट करना, बट प्लस आउटरीच को हम आगे कैसे लेके जाए। एंड वी विल बी इन टच। एक कोर ग्रुप है कंसोर्शियम का जो मिलता रहता है रेगुलरली। हम वी आर होपिंग कि अभी अगले बिफोर द एंड ऑफ द ईयर एक हम वर्चुअल मीटिंग न करते हुए एक फिजिकल मीटिंग करें इन पर्सन 1-2 दिन का, जहां टू रियली स्ट्रेटेजाइज ऑन कैसे ये पूरा अभी जो लर्निंग्स हुए, जो पॉलिसी डायरेक्शंस आए हैं सारे डिस्कशन से एंड पैंडेमिक के दरमियान, उसको कैसे हम एक्चुअली एक कैंपेन में लेके जाएं। सो वी विल डेफिनेटली रीच आउट टू ऑल ऑफ यू। थैंक यू ऑल, नॉट जस्ट फॉर योर टाइम, बट आप सभी का जो काम आप रोज करते हो, बहुत ही मुश्किल परिस्थितियों में हम सभी की बात आज नहीं सुन पाए, बट आई जस्ट वांट टू अप्रिशिएट दैट एंड आपके सॉलिडारिटी के लिए भी। एंड आई एम श्योर कि टुगेदर we will really be able to influence the social policy of the state of Maharashtra. So once again, thank you, and please do stay in touch. Good afternoon.